Good morning. Welcome to our February 9th, 2021 Board of Supervisors meeting. We'll call this meeting to order at 9 o'clock a.m. Can we have the Pledge of Allegiance by Ms. B. Gonzalez?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Can I have an acknowledgement certificate of posting?
So moved.
Is there a second?
I'll second.
Collins first. Supervisor Tiffany second. All in favor?
Aye.
Aye.
Opposed?
Aye.
5-0. The notice of temporary procedures for the Board of Supervisor meetings. Clerk of the Board or Assistant Clerk of the Board?
Good morning, Board. Good morning, community members. Members of the public who wish to speak during public comment periods, please press *9 or the raise your hand icon. Each speaker will have 3 minutes to speak. Thank you.
Just on a side note, I know our CAO will be updating us later on today, but we do have a contract in to upgrade our system here, which will be much more beneficial for the users that are not in the chambers. So he'll talk about that later on this during his announcements. Presentations and recognitions, I see we have none. Public comment. This is the opportunity to address the board on items of interest not appearing on the agenda. No action may be taken unless provided by Government Code Section 54954.2. Ma'am, is there any public comment?
Chairman, I have one comment to read out loud. It states, Dear San Benito County Board of Supervisors, please direct the county planning staff to not process any development applications for the acreage, approximately 3,000, that was part of the Strata Verde proposal. As you know, the voters recently rejected any development on these lands. Instead, developers are directed to infill on lands that are already zoned for commercial and industrial development in the Hollister vicinity. Processing any applications to build on the land that was rejected by the voters would constitute another end run around the will of the San Benito County voters. Thank you. We have Andy, please state your full name for the record. You will have 3 minutes.
Hi, my name is Andy Shaw-Coron. I live in Aromas, and I'm urging the supervisors to respect what the voters have said to them. The developers for the Strata Verde project made a decision that they wanted to bring this development project to the people rather than to the supervisors. They said this was such an important decision that the people should be rendering a decision on this. Resources went out, people signed signatures, and it moved from your arena to the direct vote of the people. And there was a lot of debate. Huge resources were applied by the developers, far more than we had, 20 or more to 1 in resources. And the people strongly voted to reject the idea of rezoning and allowing for this project. Now, for them to come back to you guys and ask you to now give them a go-ahead to enable them to move toward this project, to use a underused word that should be applied, chutzpah, it is galling that they should do this, and you should in no way enable them to go forward using this route. I think it shows profound disrespect to the people, and I urge you to, in every way possible, send a signal that they had their opportunity and it has been rejected. Thank you so much.
Thank you, sir.
Philip, please state your full name for the record. You will have 3 minutes.
Say again? Was that for me?
Yes.
Oh, okay. Good morning. My name is Phil Esparza. I'm speaking today in full and unequivocal support of the San Benito Health and their amazing and dedicated staff under the outstanding leadership of Rosa Vivian Fernandez. The foundation is a nationally recognized, federally qualified health center. The foundation provides needed medical services and support to the entire community of San Benito County. The foundation focuses specifically on our underserved farm worker, immigrant, and other working class populations who are often overlooked and underserved by traditional health services. It has developed a trust bond and demonstrated ability to communicate effectively and consistently to these communities via digital and analog means. Fully 20% of our community have insufficient or no internet services, many of them seniors, and require communications via more old school means, which are employed to great success by the foundation. The foundation is on the front lines of providing vaccines and adequate health care in its effort to overcome the COVID-19 epidemic in partnership with the county health department and other health organizations in the county. The primary goal for this effort is to get vaccines into the arms of our people as fast and efficiently as possible. The foundation has ramped up to do its part. It has delivered all the first vaccine dosages as directed. All the administered doses have been documented and reported daily to appropriate local and state agencies. Given the often confusing and contradictory mandates from the federal, state, and local agencies, submissions and questions may come up. These concerns should be addressed professionally via the established protocols and procedures, not in the press. It is imperative that the allocation and delivery of vaccines by the foundation not be impaired or delayed. This pandemic is real. People are getting sick and some are dying. Please do not let personal agendas, organizational egos, and/or institutional bias stop the flow of vaccines into the arms of the community. The San Benito Health Foundation is ready to do its part. We stand ready, get the vaccines into people's arms. Adelante. Thank you.
Thank you.
Caller ending in 248, please state your full name for the record. You will have 3 minutes. Caller, please unmute yourself. You've been unmuted.
Hello, my name is Frank Berrigan. I live in District 2. I'm here to speak about the Strata Verde Measure N. I know there's people out there talking about the Strata Verde and how the developer wants to continue to push this project forward. After a 2-to-1 vote, pretty much almost a 2-to-1 vote in our county voted no on Measure N. And I hope the board is just going to respect the voters. I know there's a lot of political turmoil right now, and people talking about how government's going against the will of the people. And I just hope that this board really listens to the will of the people. It was almost a 2-to-1 vote that they voted no on Measure N, and I just hope that this board will just squash the project and listen to the people, and it's make things happen in the future for San Benito County. Thank you.
Thank you, Mr. Barragan.
Caller ending in 255, please state your full name for the record. You will have 3 minutes. Caller, we cannot hear you. Please unmute yourself. DC, please state your full name for the record. You will have 3 minutes.
Hello?
Yes.
Hello? Can you hear me?
Yes.
Okay, thank you. Good evening. My name is Daniel Camacho. I live right here by Calaveras Elementary School. I really enjoy living here in San Benito County, but like many, I'm worried about our future. In recent years, there has been a lot of discussion about what kinds of development we should allow. We are looking at benefits the project might or might not bring and what problems it might cause. They're not easy questions, but they deserve our attention. I paid close attention to the campaign about the Strata Verde development last fall. I was listening carefully to the developers' promises of jobs, and I also heard their opponents' fears about traffic, chemical dangers, and lost farmland. A good debate about an important issue. In the end, the voters were decisive, going strongly against it. I can't know why each person voted as they did, but they clearly decided no. So now the Strata Verde development should be behind us, with our focus on the many other challenges in our community, such as COVID. But I understand the Strata Verde project can be approved by that county and board through the normal review process. That would be wrong. We shouldn't let a developer override the clear will of the voters. The board should remove it from any further consideration. The board, at the developer's request, put the plan on the ballot and asked the voters to decide, and the voters did so. Their verdict must stand. The election also left us with an important lesson. Clearly, voters were worried about a development being built so close to a dangerous toxic chemical plant, and we know the county-specific experts recommend a 3.5-mile buffer zone for safety. The board should send a clear message that the safety will not be compromised in this county. It should create a 3.5-mile buffer zone as a rule. It will protect community safety and provide guidance for proposed projects in the future. Projects like this raise difficult decisions for our community, but they are important. And whether we get the result we individually want or not want, as a community, we need to be able to trust our democratic voting process. In a democracy, the voters are the ultimate deciders, and their decisions should not be overturned. On the contrary, it should help guide your planning for our community's future. Thank you very much. Thank you.
John, please state your full name for the record. You will have 3 minutes.
Hello, this is Dr. John Troidel. I'm a doctor of public health with long experience, John J. Troidel, with long experience in community and governmental health. My comments address the great support that the community health centers across the United States, including at the San Benito Health Foundation right here in San Benito County, are receiving for improving the vaccinations of residents going forward. For one, the federal government is moving to enhance and increase the role of community health centers in directly providing vaccinations to the community, as described in the President's strategic plan for COVID-19. I saw a table from HRSA today for a presentation that's going to be given later today that indicated that immunizations at community health centers have gone from 29,000 to 442,000 in a very short period of time, and it's going to go up. Recently, the governor moved to rescue an anemic vaccination program in California by contracting with Blue Shield, which will work with pharmacies, local providers, and specifically will work with community health centers to improve the dissemination of vaccines. San Benito Health Foundation is and will continue to be an important partner to San Benito County, and I recommend that the health department make all efforts to reconnect and strengthen that partnership. San Benito Health Foundation stands ready. Thank you.
Arcadio, please state your full name for the record. You will have 3 minutes. Arcadio, please unmute yourself. You've been unmuted. Jackie, please state your full name for the record. You will have 3 minutes.
Yes, good morning. My name is Jackie Morris Lopez, constituent in District 2. I just want to sound my opinion as a voter, as a constituent, and a newly elected planning commissioner in the city of San Juan Bautista. When does no mean no? The voters of San Benito County spoke loudly and clearly. Over 60% of the voters denied Strata Verde by the non-passing of Measure K. I feel that as the democratic process goes forward, it's time to really look hard and fast at what we as elected officials or appointed officials represent. We represent the will of the people and the voice of the people, and they spoke loud and clear back on November 3rd. And also, just to recap what a speaker said a few speakers ago, Mr. Camacho, Daniel Camacho, I agree 100% with his comments. They were spot on. And he said, you know, this is a hard decision that we all have to make. What kind of growth, where the growth goes. But also, let's put it back on the developer. They themselves said that it was so important coming to our county with this growth of development, this type of development in the location particularly, that they wanted to let the people decide. And we did decide, and we said no. My second comment is in regards to the San Benito Health Foundation. My history goes back about 30 plus years as a medical assistant, starting out my career in the medical health care field. I have since gone to school and become a physician assistant. I understand what the Health Foundation does as a community resource clinic, a very much needed health service to the underserved, the farm workers. It started on the backs of farm worker needs. We know that clearly, but it's never unfair or a bad decision to constantly look and see what things are going on at a community clinic. It's called responsibility, accountability, community review, whatever you want to call it, you know. And as far as the comment about it not going to the press, I think if it doesn't go to the press, then people that would need to know about the information would not get that information. But I just think that, you know, they are doing a great thing with providing healthcare services. But if there was something that was done without the guidelines being handed, you know, the one thing that kind of sparks with me being from San Juan is the vaccination of the Rotary Club members of my city. I think that needs to be looked at. I think there's always room for mitigation and to move forward so that they can be part of the vaccination drive in our county. But like I said, there is accountability that must be held and overview and oversight. Thank you.
Thank you, ma'am.
San Benito Health Foundation, please state your full name for the record. You will have 3 minutes.
Good morning. My name is Irene Guevara, and I'm speaking on behalf as a member of this community as well as the HR director of the San Benito Health Foundation. I wanted to address the fact that there's been a lot of misinformation that's been given to the public. Within the first 3 weeks of January, as we begin to administer vaccinations, we were able to successfully deliver 789 vaccines to our community, and within that, 37% actually went over to the population that was over the age of 65. Of the 100 that we received for our FQHC, 30 were administered to our urgent care in support of taking care of our healthcare team, in addition to the over 640 IHHS workers that we were delegated by the Public Health Department. Our team actively, proactively, and enthusiastically reached out to all of these workers to get through the tiers as quickly as we could. And it's disappointing to me that we as volunteers to this process and helping our Public Health Department and partnering together have been damaged as an organization by the local voices within our community that have not sought the truth or have assumed before having the information. We as a community need to know the truth, and are encouraging our community to continue to advocate and stand for us to ensure that all vaccines are not sat on, like the 400 that were sat on during the holiday season while we lost another 10 lives in our community. The power of vaccines is in really the vaccination, and we stand ready to partner and vaccinate. Thank you.
Thank you.
Caller ending in 255, please state your full name for the record. You will have 3 minutes. Caller, we cannot hear you. Robert, please state your full name for the record. You will have 3 minutes.
Hi, my name is Robert Lund. Can you hear me okay?
Yes.
Okay, yeah, my name is Robert Lund. I'm the board chair for the Community Health Foundation. I recently came across the COVID-19 vaccine allocation guidelines. This is from the state. As we know, federal supersedes the state supersedes the county. And when I read this, I was totally amazed that we are in our guidelines. Based on the availability and supply, individuals described below or will be eligible for COVID-19 vaccines. Phase 1A, Phase 1B. Persons 65 of the age and older, sector populations, education and childcare, emergency services, food and agriculture. Achieving equity. This age-based framework will be coupled with a vaccine distribution and engagement approach that prioritizes disproportionately impacted communities, setting, and populations to ensure those eligible for vaccines with these communities are more likely to receive it. Big letters minimizing disuse of scarce COVID-19 vaccines. To avoid wastage or disuse of scarce supplies and maximize their benefit to California. Allocations of doses are made on the assumption that immunization will be accepted by some, but not all, who are offered the vaccine, and then adjust later allocations based on the number of doses that are accepted. After focused and appropriate efforts to reach the groups prioritized at the moment, providers may offer vaccine promptly to persons in lower priority groups when demand subsides in the current groups or doses are about to expire according to labeling instructions. Providers may temporarily adjust prioritization based on other resource constraints while continuing efforts to immunize higher priority groups as soon as feasible. Now that is from the state. That is everything that we've followed. We've been persecuted without evidence and without being investigated. You've taken action without investigating and threatening us for further persecution. We need to get back on this list. We need to get these vaccinations going again. We need to protect this county. We need to get back on track. We're working with everybody. We have a high volunteer. We've given out over.
Thank you, sir.
Caller ending in 445, please state your full name for the record. You will have 3 minutes. Caller, you've been unmuted. Please unmute yourself. Laura, please state your full name for the record. You will have 3 minutes. Laura, you've been unmuted.
Yes, okay. My name is Laura Stampelman. I'm a physician and member of the board of directors of the San Benito Health Foundation. I enthusiastically became a member of the foundation because of its mission to provide comprehensive health care to the historically medically underserved among us. In my oncology practice, I have seen firsthand patients who presented with late-stage incurable cancers due to lack of good primary care and cancer screening, which only reinforced my support and commitment to community health centers. I have supported the intensive efforts of the Foundation's director and staff to do the laborious work of training and record keeping required to be a mass vaccine provider. Our clinic has vaccinated 789 patients successfully thus far and is prepared to continue up to 200 to 300 vaccinations per day. Unfortunately, our vaccination program was abruptly terminated by the County Public Health Department. The reason given is that there have been complaints that the San Benito Health Foundation allowed some vaccine recipients to jump the queue to receive their vaccines. We on the board have reviewed the data on vaccine administration meticulously compiled by our staff and are confident that we have followed the state guidelines as noted by our board chair, Robert Lund, and which emphasize that the goal is to get as many people vaccinated as possible and leave no vaccines unused. As we're supposed to be partners in collaboration with the Public Health Department, we assume that any concerns would be raised directly with us and addressed in a professional manner. The interpretation of guidelines has been difficult throughout the state, and guidelines are continually updated. Indeed, the health department has weekly COVID Zoom meetings, and our clinic is the only partner regularly attending. Instead, the county issued a reverse 911 alert and a media blitz to notify the public that the foundation was being investigated. By creating this fake emergency, the county has caused a real emergency, namely withholding of vaccines in the midst of the deadliest pandemic since 1918, and a vicious social media campaign, which has resulted in personal attacks and threats against our CEO, our clinic, and members of the board of directors. Haven't we seen the negative consequences of governance by mob mentality on a national level? Is this how our county chooses to proceed? The San Benito Health Foundation is a federally qualified health clinic, and we will continue to uphold the mandate given us by the federal government, which is to serve our community. We stand ready. Thank you.
Thank you, ma'am.
Caller, please state your full name for the record. You will have 3 minutes.
Hello, I am Carla Perez. I was born and raised in Hollister. Right now, I am a stay-at-home mom raising 2 children in Supervisor Gonzalez District. Congratulations for your election. Thank you for allowing me a moment to speak today. I care a lot about this community, and I am concerned about its future for our children. In November, the voters were asked if Strata Verde development is right for our community. The project developers chose to put it on the ballot so voters could decide. Voters said no by almost 60%. It was not even close. And in democracy, voters have the final word. So the project should be finished. But recently I learned that the Strata Verde project is still up for consideration by this board and the county. I was stunned it could still be approved. Even though a big majority of the voters said no, it is just not right for the voters' decision to be final. It's just not right. The voters' decision should be final. The developers made their case to the voters. They ran a campaign and explained their side. Opponents questioned the safety of the location and the increase in traffic and whether farmland should be torn up for this development. County voters heard both sides. They thought about it and they firmly voted no. A clear decision was made. So how can Strata Verde still be up for approval? It should not be. To approve it now would directly defy the voters' decision. The board needs to respect the voters' will and do whatever is needed to remove the project from consideration once and for all. We, the voters, were asked and we decided. Thank you.
Thank you, ma'am.
Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for calling my name. I want to congratulate the San Benito Health Foundation for rounding up the wagons and trying to get people to come in and speak this morning. I wish they would have done that a lot earlier when their CEO went rogue and started vaccinating Rotary members and people that were not on the correct tier that they were supposed to be. This is all in hindsight, and it is offensive to say that it's a mob mentality that's going after the San Benito Health Foundation. What they should be, these board members that called in today should be questioning what the CEO did. The CEO did not follow state protocols and federal protocols. There's an agreement that was signed between the San Benito Health Foundation and the public health. Rules must be followed. She broke the rules. This is unacceptable. The CEO should resign from this. Some of those members of the board should resign for defending her actions. I know that as a board, the supervisors do not have any authority over her. I appreciate Supervisor Comiskey giving us information out there about what's going on with the vaccinations. I truly, definitely appreciate Supervisor Chair Mark Medina for actually going out and questioning what's going on. What has happened? Everything that's being said is now in hindsight. They're rounding up the wagons and they're trying to defend themselves for the actions that were inappropriate. I don't know if they were illegal, but they're definitely unethical. You jumped the line. Not one member that I know of in this community that received the vaccination has stepped forward and apologized. And even if they were to say, I did not know that I could not do this, I did it, I would never do it again, not one member in our community has stepped forward to say that. And that is really a lack of character for those people that took those vaccinations. There's many out there that did it. I would like to see some kind of accountability, and I know that the Public Health Department is working on it. The priority now is to make sure that the elders and those that are the most vulnerable should be getting the vaccinations. And I definitely agree that the Public Health Department should not get the San Benito County Health Foundation involved. I appreciate their what they do and what they have done, but what they have done and not apologize with regards to the vaccination has totally destroyed their mission for all the good that they have done. They need to get credibility back. I thank you and appreciate you letting me speak.
Thank you, ma'am.
Natasha, please state your full name for the record. You will have 3 minutes. Natasha, you've been unmuted. Please unmute yourself.
Hello,
Yes.
this is Natasha Wist of Hollister, and I'd like to comment on the Stradivari reconsideration. For some reason, I'm just flummoxed. I can't understand why our Board of Supervisors, after hearing from the people more than once that we don't want this kind of a development, and having their own environmental experts say it's hazardous and unacceptable, why they keep reconsidering this project. And I keep asking myself, what is the Board of Supervisors getting out of it? I don't know, unless they just are very stubbornly saying we don't care what the people want. This is what we, the Board of Supervisors, want. So it just absolutely amazes me that this keeps coming up again when they have the right to tell Stradivari, look, you've heard the people, we've heard the people, goodbye, we'll see you, never again. So that's my comment.
Thank you, ma'am.
Loretta, please state your full name for the record. You will have 3 minutes.
Good morning, this is Loretta Avina, and I'm calling regarding the San Benito Health Foundation. I completely support the investigation that is going on right now because regardless of what everybody's saying, nobody is questioning the work that they've done in the past. What they are questioning are the current actions of the CEO. Facts are that she did go rogue. She hijacked the vaccines and she vaccinated people that were not in the correct tier at that time. It's been documented. You know, these people that were vaccinated out of tier, they went on Facebook. They were proud to share their good fortune of getting a vaccine. These people were not healthcare workers. Volunteering for a food donation drive, whatever it may be, 3 times a year does not constitute them being frontline workers in the food industry or agricultural industry. They are not farm workers. So what happened? What happened is that this action, this rogue action by the CEO, caused the public to lose complete faith in the and trust in the San Benito Health Foundation and in her actions. So the only way that we're going to be able to regain this trust is by completely replacing her. I don't understand why people do not see the immorality of her actions. It's embarrassing, and for these members to not even come out and say that they're even sorry, as one of the callers just previously said. It is an action that definitely needs to be investigated, and this Health Foundation has shown that they are not ready to do their part, and that was demonstrated by their actions. Therefore, they should not be allotted any more vaccines because we cannot trust them with their actions. So their actions also caused people, for every vaccine that went into someone who was not qualified to receive it at that time, caused a person who was available to be vaccinated in Tier 1A at the time, because there were still members in the 1A tier that needed to be vaccinated, it caused them to be further delayed.
Ms. Rose Vivian should have reached out to public health agency and worked collaboratively with them if indeed there was leftover vaccine, because there were people out there that were available to be vaccinated. She did not do that. She needs to be replaced. And I appreciate my supervisor, Mark Medina, so much for literally going out there and demanding answers. If truly there nothing wrong was done, then Ms. Vivian should have no problem coming clean, and she shouldn't be this defensive. Thank you for listening.
Thank you, ma'am.
Arcadio, please state your full name for the record. You will have 3 minutes.
Yes, good morning. My name is Arcadio Viveros, and I'm the Vice Chair of San Benito Health Foundation. Last time I addressed this body was late January during that meeting that you had. At that time, I spoke of the importance of collaboration that should exist between the county and San Benito Health Foundation. This is a paramount importance and necessary in joining the fighting and defeating this COVID-19 pandemic. We are mutually mandated. We have obligations, and our commonalities are more than few petty differences. For local governments, are obligated to provide for the health and welfare of its residents. Likewise, San Benito Health Foundation has similar mission to provide high quality primary health care and disease prevention programs, especially for the county's vulnerable, medically indigent, and migrant and seasonal farm workers and their families. We both have been affected by the COVID-19 vaccine rollout. And although we have the capacity to vaccinate about 1,000 county residents per week, the initial normal allocation coming from the county has recently been unjust put on hold. This is totally unacceptable. For the withholding vaccines, you are also putting county residents' lives in grave danger and even death. During this times of COVID-19 pandemic, more than ever, our responsibility is tested and our leadership in action is needed the most. We are called to stand together fighting the enemy, the coronavirus, a deadly pandemic virus which has disproportionately affected communities of color, especially the poor and the farm workers. In light of this emergent situation, both the county and the foundation are called to set differences aside and come together as one. By joining our efforts, we can vaccinate as many county residents as soon as possible. Doing otherwise and not giving us our allocation is not an option. We could be vaccinating up to 1,000 San Benito County residents per week, but not allowing us to use our capacity. You are denying access to COVID-19 vaccines to 1,000 residents, which is the gift of life. In this time of pandemia, we cannot afford having 1,000 residents.
Thank you, sir. Thank you.
Doctor, please state your full name for the record. You will have 3 minutes.
Good morning. My name is Roberto Dancy. I am a doctor in psychology and a speaker. I have worked as a partner and consultant with San Benito Health Foundation since the beginning of the pandemic. Through the use of local radio and the use of virtual technology, we have focused on reaching the harder to reach population at most at risk for COVID-19, the farm worker population, the essential workers, the ones who feed us all. San Benito Health Foundation has been outstanding in building trust, in building rapport with this key population. They have been effective because they speak the language of the neighborhood. They know the culture of the community, and they have built trust with the community since 1975. Its founding members and board members, of whom we have just heard one speak today, Arcadio Viveros, they marched and worked with Cesar Chavez, whose bust you see today proudly displayed in the round office of the President of the United States. We have other founding members who, like Noé Montoya, who was the leader of Teatro Campesino, headquarters right there in San Juan Bautista, who was taken from us by COVID-19. He keeps his bond of love and solidarity with our farm worker community and reminds us to be there for the people. We know him, we mourn the ones who have fallen, and we remember them. And they continue to move us to do the best thing we can do, and that is to reach the farm worker community like no one else can in San Benito. That's San Benito Health Foundation. In order to do justice to our farm worker community, we respectfully request that no interruption to the flow of vaccines be made again, especially when somebody's treated as guilty until proven innocent, an assumption.
Thank you, sir. Thank you.
We have no more speakers via Zoom at this time.
Seeing there's no more speakers, we'll go to department head announcements. This is informational only. I repeat, informational only.
Thank you, Mr. Chair. We have a few announcements this morning. Our first announcement is from our IT department, and I'll go ahead and highlight that. As you stated earlier, Mr. Chair, regarding the new system, we actually went out and looked for a new system right after the request to bring one in. We ordered the system in January. It is a TC2 system, a TriCaster 2 Elite system, which will, I think, benefit us greatly. It's on back order. There's a lot of counties and jurisdictions doing the same thing to better streamline Zoom and you know, the voice technology with it. So I just wanted to share that with you. We're looking at mid to late March on receiving it and having it installed. So hopefully there's no issues with being further back ordered down the road. So I wanted to give the board an update on that. With regards to item number 29, I believe, it's from the clerk of the board's office. This particular item, there was a typo. There was a period instead of a comma. It should have been $1 million instead of 1,000. So that's just an error with that. Just wanted to make sure the board was aware and privy to that. A reminder, next week we have a special board meeting for the board and the public. It's going to be 2/16. It's going to be at 9 o'clock, a Zoom as well. It will be here in the chambers, but it'll be closed to the public, and it will be just a board retreat that we have every year to discuss. Really, it's going to be an educational kind of part 2 to what we had before, but more from an operational point of view. So it'll be very educational, I believe, for your board as well as the public, and to really get you up to speed on what's happening within the county, the state of the county. We also have an item out of our HR's office. I'd like to invite Edgar Nolasco, our deputy CA, up, and he's going to give you a quick update on policy.
Good morning. Good morning, Chairman, members of the board. From our last meeting,
we took the advice and the direction of your board, and we moved as quickly as possible on fulfilling the COVID-19 policies. I just wanted to share with everybody that those went out in January, where they were posted on our website. We sent out a memo, a CAO memo to your board and the rest of our employees, letting them know that we have the COVID-19 policies for them to view and for everybody to use as guidance. And I just wanted to share with members of the public and your board where you can access this information. On our website, if you go under the Human Resources website, we have a dedicated page just for COVID-19. When you go to the COVID-19 page, this is for, if we had internet. Little hiccup. Sorry about that. But they are there. What I wanted to share with everybody was our website has all of our CAO messages that we put out. We have put out about 12 messages so far since COVID-19, informing employees of everything that we've been doing, guidances that have changed, policies that have changed internally in order to help employees. And the COVID-19 policies are there as well as other resources for employees to use. These policies and all of our communication is available to employees as well and members of the public from the outside, and is mobile friendly as well. And if you have any questions, I'll open it up.
Any questions from any board members?
No questions, but I just want to say thank you for addressing that. It's greatly
Working
appreciated.
now, so
Thank you.
here's all of our resources, forms that we have for employees. Also, thank you to the board's leadership. We did put in the form for employees who we extended FFCRA, the use of COVID sick leave, the 80 hours until the end of this fiscal year. All of our information's here. Also, some of the COVID times that our Health and Human Services agency is putting out, and our policy is right here for everybody to view.
Thank you.
Thank you, Edgar. And thank you, HR staff. Appreciate that. We also have another announcement out of our county counsel's office.
On item number 21, we passed out a revised resolution which made some minor changes to the resolution. Specifically, it makes a specific request for financial assistance. That was, I think, the most significant change, and we uploaded it into Novus so it's available to the public.
I'd like to thank all of our staff, administration staff, in particular Dulce Alonso, our management analyst. She's been working extremely hard with our ad hoc committees. And I just wanted to take a minute or two to thank staff. There was a lot of time and effort over the last 3 weeks, 3.5 weeks at our ad hoc committee. I'm sure we'll be highlighting some work that's been done. But I just wanted to take this few minutes just to thank staff because they've done a heck of a job. And that's everybody, county council, just everyone's been doing a great job. One last thing, I'd like to go ahead and invite up Gracialla Rodriguez. She is our new management analyst. She was recently promoted, and we want to thank her for all her efforts and time to fill a gap in our office, and so far she's been doing a great job, so we're really glad to have her. So I don't know if you want to say a few words.
I just want to say I am very grateful for this opportunity, and I look forward to continue to work with community members and our board, as well as my colleagues here at the administration office. Thank you.
Thank you, Gracie. Appreciate that. That's all the announcements I have, Mr. Chair.
Mr. Sheriff? Anything out there from the Sheriff's Department? Fire Department?
I have something if you pull it up, but
Okay. See none. We will go to board announcements. This is informational only. No action may be taken. We'll start off with Supervisor Tiffany.
The only, I don't have any announcements. I was just going to chime in on what Ray just said. I think Both Supervisor Kuzmicki and myself have been working on the ad hoc committee. We've had tremendous support from the entire county staff, whether it be in the enforcement area or the business grants, and or now in vaccines. Anyway, I would like to say also the support of county staff has been tremendous, and it's greatly appreciated. Thank you.
Supervisor Gonzalez?
Actually, I've been attending various meetings, and I have some concerns, and I'll make a statement later on about the San Benito Health Foundation. But I also want to thank staff for going over and beyond on any concern that I have, that you guys are very eager to address my concerns, so thank you. I look forward to the presentation on the vaccines in terms of what's going on, because since I'm not an ad hoc committee, I kind of feel that uninformed, as well as the public, and so I am eagerly awaiting some sort of report, because as a supervisor, you would think I have that information, but I don't have it to share with anyone who's calling and asking, so I'm looking forward to that. But this county, the state, the federal government has had a poor response in addressing to the vaccine, and it's created a significant issue in the community, and so I will address that later, but thank you.
Supervisor Kuzmicki?
Thank you, Chairman Medina. First off, I would like to request that we place an item on a future agenda in light of some of the comments that were made during public comment for just to get a review of the Stradivari project. I would
Okay.
like to know just at the board level.
Can we put
where
that on
we're
the
at.
23rd?
Yeah, we'll just
Put it on the
that on.
23rd, please. So we will put it on the agenda
Appreciate
for
that.
February
Yeah,
23rd.
Appreciate that. And I'm really glad to hear about the IT system. I'll try to run through this stuff quick. And I just want to say I hope that it's a sign that we're going in sort of a more permanent direction. I think we've learned that the more the better when it comes to public access to our meetings, and yeah, I'm really, really excited that we're improving our IT on that. As far as everyone here knows, Supervisor Tiffany and I have been very, very busy for the last, I guess it's going on a month now, with ad hoc committees, starting with the enforcement ordinance, going next to the business grant program, and now dealing with the vaccine issues. And again, I just want to reiterate just how grateful I am for the level of dedication that we have in this county. There's day-to-day work to do, and everything that's been done in the last month or so goes above and beyond, I think, normal expectations. And but it's so needed, and these are urgent issues, and I'm just really proud of our staff and Supervisor Tiffany for stepping up and really taking the bull by the horns and doing tremendous work at it while doing that as well. It's not just the amount of work, but I feel that it's been really tremendous, the product that's come out of it. So thank you to everybody. Again, the business grant, thank you to Chairman Medina for appointing us to that ad hoc committee, and we got rolling right away. We held several staff meetings to develop the program as quickly as possible because of the level of urgency that's involved, and we held an oversight meeting where we invited members of the business community to specifically some of the areas that we're addressing, such as personal care services, restaurant owners. We wanted to make sure there was a member of the Latino community and business organizations to sort of give us oversight on the program and critique it. We're open to, I think that's a really important part of a process like this, especially because we put it together so quickly, and I really appreciated all those people that took part in that. And so then we held workshops last week, I guess it was Thursday, 3 workshops, 2 in English, 1 in Spanish, and I thought those went really well. And again, thanks staff for putting those together. And just to, again, reiterate that the small business grant program from the county the application is now open for businesses that are interested, particularly businesses that have been closed or have been forced to significantly modify due to COVID-19 restrictions, and that application is open until the 21st of February. I know that's going to be covered later, but I just want to, it's so important. I want to get it out there here now as well. And so we invite businesses to apply, and you can go to the county website, cosb.us, and you can find the application there. Do want to congratulate Gracialla. Appreciate you stepping up. Thank you for that. And just a couple other things on the business grant program. I held a meeting with the San Juan Bautista Business Community Focus Group. I thought that, and that was last week as well, just to update them, to make sure that I'm getting the information out in my district. I also dropped off business grant information, San Juan Bautista, Romas, and some other businesses in the community that fall within my district. And then just real briefly on the ad hoc committee, the vaccine, we as a board, I think, I can't speak for everyone, but and as a staff do understand that there has been, and again, I know we'll speak to this later, but there has been a lot of confusion on the vaccine distribution. And, to be fair about it, a lot of that does come from the state level and the fact that we're, getting really shortchanged on our vaccine numbers. So I really appreciate Chairman Medina and the staff support in getting a couple of our supervisors, myself and Supervisor Tiffany, in on those discussions, because ultimately we're held accountable here in this community, and it's important for us to have a voice. And I do also, like Supervisor Gonzalez mentioned, look forward to the update later. But those have been very productive meetings, and I appreciate the staff's dedication. Our staff, some of our higher up staff works 7 days a week. They work late hours. We have a really, really dedicated staff, and I think, again, I think that it's really important just to underscore that for the public to understand the level of dedication that we have here on our staff. Real briefly, Supervisor Hernandez may chime in on this as well, but we held a meeting on Friday, another ad hoc committee that I'm on with Supervisor Hernandez, with San Benito High School and the city of Hollister on the negotiations over closing Nash Road potentially, and taking further steps to develop our regional park project. And I just generally want to say that meeting went very well, and I'm very optimistic that we're taking steps forward now on that, and I'm sure we'll have an update on that as well at some point. But there's very good news out of that meeting. And then I'm sorry, I'll wrap up here soon. There was so much from the last month, but just a small thing on meeting agendas. I just, I'm only one supervisor, but when it comes to expenditures, I'm hopeful that we can make sure that we delineate on the agendas whether those expenditures are coming from the general fund or just, I think, from the public's perspective on this sort of thing. Sometimes we get wrapped up in our level of expertise on the staff, but I think it's beneficial for the public to know if dollars are discretionary or if they're coming from other sources. I got a call from a constituent about extremely disturbing level of trash along Union Road. And I'm hoping that we can, at some point, I know we're all very, very busy, but I'm hoping we can at some point have a discussion about trash and illegal dumping. That seems to be a particularly big issue in my district. I can't speak for other districts, but illegal dumping and trash. And when I'm driving out, I know it's a California issue, but when I'm out driving, and it really jumps out to me oftentimes how much trash, people dump on the side of the roads. And so I'm hoping that we can do something with that. And myself, I'm committed to, I think when things calm down here a little bit with COVID, to being a lot more involved with volunteer work as far as just setting an example and getting out there and doing trash pickups. It's something that I've done personally in the previous months, but I'm going to commit myself to that. And that's it for me. Thank you very much.
Supervisor Hernandez.
Thank you, Mr. Chair. Yeah, just to piggyback a little bit on what Supervisor Kosmicki had mentioned, we had a good meeting with the high school and the city. Sounds like there's going to be some good negotiations happening soon to advance the goals of that regional park. And then I also had a separate meeting with Supervisor Gonzalez and staff, and we basically went over the public defender protocol. That the ad hoc is getting a 5-member committee together to ultimately get public input, and then also to make sure that we have, which it sounds like, and I don't want to speak for Supervisor Gonzalez, there's a strong interest to make sure that there's clarity on how the public defender, ultimately there's reporting back and a better understanding of metrics making sure that position is representing the public interest, right? That it's actually making sure that those folks that are being represented, that their voice is heard also. So thank you, Mr. Chair.
Thank you. I will be real quick. Just wanted to say thank you to specifically Supervisor Tiffany and Supervisor Kosmicki. They've done more than a lot of people have done in months. I mean, we're talking Great Plates. We're talking the business grants, COVID. They're always doing something. Whenever I call, they're always on a conference call or on Zoom or doing something. So I appreciate the time you guys are putting into this. Makes my job easier. So, and just, you know, of course, with Supervisor Hernandez and Supervisor Gonzalez, with the public defender, you know, it's just everybody working together, doing their part, and it's going to make a great board for the years to come. So I just want to say thank you for that. I also want to say thank you to the chamber. The chamber is taking care of the Great Plates. I think they're up to roughly 500 people. Is that right? You know, and before that we were at half of that. Is that right? We were in the 300s, 250, 300. Yeah. So you know, just takes a lot of people. So I appreciate that a lot. Other than that, we will continue down our agenda. Who's first? Yeah. Thank you. Thank you. So now we'll go to our consent agenda. Is there any items that anyone on the board would like to pull?
Mr. Chair, I'd like to pull item number 21.
Okay, Mr. Tiffany, 21.
Mr. Chair, I'd like to pull item number 9.
Peter, number 9? Is that right? 9?
Yes.
Okay.
Mr. Chair, items 17,
Okay.
22,
22.
23, just briefly, it's in my district. 25, 26. Actually, I'm okay on 26. I don't know if we need to pull that or not.
Okay.
Well, I was going to ask for 26 just to, sorry. I was going to ask for 26 to be pulled just so that we can explain
Right.
the capacity issue to the community.
I appreciate that.
I understand it, but I just want the community to know that we're in between a rock and a hard place with regard to refuse and waste, and something's going to be need to be addressed.
Anyone to be pulled from the public?
Members of the public who wish to pull an item, please press star 9 or the raise your hand icon. Elia, please state your full name for the record.
Yes, I would like to pull 13, 15, and 16, please.
Say that again, ma'am.
13, 15, 16.
Okay. Any other?
Thank you.
Anyone else would like to pull any items?
We have no more speakers via Zoom.
Okay, so I have this straight. We will pull number 9, 13, 15, 16, 17, 21, 22, 23, 25, and 26. Am I correct, clerk?
Yes.
Management analyst? Yes? Okay. So what's the wish of the board?
I move that we approve all the consent items with respect to those that have been pulled. 9, 13, 15, 16, 17, 22, 23, 25, and 26.
Is there a second?
I'll second it.
All in favor?
Aye.
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 5-0.
Mr. Chair, you could also put some of those agenda items at the end of the agenda if you wanted to move on the regular agenda faster. So some of the RMA items could be put towards the end if you would like. It's up to the board, though.
What's the wish of the board?
I have no preference, so.
I don't either.
So do you want to say you want to go to number 30, or you want to go to the public hearing now? Is that
No,
what you're?
it's up to the board.
Well, there's no preference, so when we're looking at that, that might be the wise thing to do, because we have people that, are really,
I agree with that,
on
Chairman
30.
Medina,
Yeah.
in the interest of our public.
yeah, I don't want people to have to wait when they're on
Good point.
Zoom. Is that all right with everyone?
Sure. Yeah.
Okay, Peter, is that all right?
Are we talking about moving up item 30?
Yeah, we'll just move up, and then we'll go back to the consent after we're done with the regular agenda.
Sure.
That way it's
Sure, Mr.
just,
Chairman.
people are out there interested in a lot of the COVID stuff specifically. I don't want to keep them waiting. Okay, so we'll go to, we'll go to 29 first, the public hearing.
We have Benny here. If we're going
And-
to do 29, we have
And
Benny
just,
here.
just for the record, this does require 4/5 of a vote.
Can I get you to help me load my PowerPoint? With your indulgence, Mr. Chair, I have a brief PowerPoint.
Yes, sir.
Thank you, Jennifer. Mr. Chair, members of the board, this item is what I would call kind of a procedural public hearing. It's not really a public hearing. It's a hearing limited to the possible heirs that may have an interest in a piece of property that we need to acquire for the Union Road Bridge project. And about a year from now, we hope to be constructing a new bridge in a parallel location south of the existing bridge on Union Road. And I have a map that I think I can find, maybe with Jennifer's help, that shows you where that is. So the existing bridge is kind of in the area outlined in orange to the north of this depiction. And the new bridge is going in the area that's outlined in the pink or chartreuse or purple, depending on your color preference, south of the existing bridge. There's a parcel that's highlighted in pink, labeled the heirs of Ladd. That's the subject of the hearing today, and then your action. Your action after the hearing would be to direct us to adopt a resolution of necessity to acquire this right-of-way, including the use of eminent domain if necessary. We have already contacted all of the heirs that we know of, and they are not objecting to the county's acquisition of the land for the bridge project, which, by the way, is scheduled, I think I mentioned earlier, to commence construction about a year from now. So we're finalizing the plans and the right-of-way acquisition to be able to move forward with the project. It's about a $35 million major capital improvement investment for San Benito County. We have already published the name and named the ones that we know of, but there may be other heirs that we're unaware of. So that's the purpose of today's hearing. And I have today with me online available Brenda Guerrero. She's with a firm that specializes in eminent domain proceedings, condemnation. People call it condemnation. It's really eminent domain. Its primary purpose of eminent domain is to use the government's ability to acquire property for public projects, and the process establishes a fair and just compensation for the people that are having their property taken. So she's available if needed. It's a friendly condemnation, and we would file this, and then there would be a settlement agreement, most likely, and it would not have to go to court. This depiction shows the piece of land that we're actually acquiring, outlined in yellow. And what you would do today, unless you have further questions at this point, is simply open the hearing for the benefit of any member of the heirs of Ladd group that might wish to voice a concern or an objection to the acquisition of the land. And if no one appears, then you would close the hearing. And if you don't have any further questions, you would adopt the resolution of necessity that's attached in your packet. Be happy to answer any questions the board might have.
First, let's go to the public.
Members of the public who wish to speak on this item, please press *9 or the raise your hand icon. We have no speakers via Zoom.
Come back to the board. Any questions from any board members?
I don't have a question per se, just more a comment. Since this is dealing with a public hearing, I'm going to ask that you make sure the spellings, whoever's proofreading it, goes back. I did find an error, and I'm going to not point it out, but just be careful. Just as the sense it's a public hearing, just take extra precaution on that, please. Okay?
Mr. Chair.
It's a minor spelling error in the background.
Mr. Chair, members of the board, Supervisor Gonzalez, we will absolutely do that. Thank you for pointing that out. We'll take care of it. Thank you.
Okay, you're welcome.
What's the wish of the board?
I'll make a motion that we adopt the resolution of necessity, finding public interest and necessarily require acquisition of the subject property for the proposed Union Road Bridge Replacement Project, and authorizing and directing the County of San Benito's attorney to prepare, commence, and file proceedings in eminent domain for the purpose of acquiring the subject property in its entirety.
Second?
All in favor?
Aye.
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 It's 5-0. We will go to our regular agenda. We will start with 30, the Health and Human Services Agency. Is Tracy on the line, or?
Yeah, Tracy.
Yes, good morning.
Morning, ma'am.
Could please share the PowerPoint? Okay, good morning.
Sure, we're going to take a minute or 3-minute break. Okay, just making sure. We're back. We will start with Miss Tracy Belton.
Good morning. So I noticed I have the wrong date on here. I apologize for that. I was obviously working on this yesterday, so it is for today. So just wanted to provide a brief update on our dashboard. I think people are aware that our cases have gone down, which is a good thing to point out. We currently have 140 active cases in the county, 10 new cases from other clinics other hospitals and clinics, and 0 from OptumServe. So this is good news to report out. Next slide. So we have created a vaccine distribution dashboard. We've modified the website so people can find the dashboard. People have struggled finding it. And so if you go on our website, it is under the vaccine page. There's a link to the dashboard, but just to bring people's attention that it is the second tab on the dashboard, or page, if you will. So we are trying to update this as information becomes available. We have to get the information from our local providers on the doses that are administered, and so sometimes it takes us a little time, but we are working on updating the dashboard at least on a weekly basis, hoping for Mondays. So just wanted to provide a brief update here that we have received 3,825 first doses of vaccine. That's Moderna and the Pfizer. 3,268 have been administered. And the appointments are being scheduled ongoing with the providers that are listed in the right corner of this dashboard. 1,750 second doses have been received and 675 have been administered. We are currently still vaccinating in phase 1B with a prioritization to 75 and older based off of the state's guidance. And we have a longer presentation on vaccine distribution later by the health officers. This week we were allocated 600 vaccines for the week, and they will be distributed to the providers. We will be putting out information as to what providers will be getting what for this week. We got 685 second doses. 400 were allocated to the Health Foundation to match their first doses that they gave, and 85 to Public Health and the hospital of the Pfizer vaccine. Next slide. So just wanted to provide a brief update that just remind folks that we are in the Blueprint for Safer Economy now, no longer in the regional stay-at-home order. And unfortunately, our county is still at a pretty high case rate per 100,000. As of last week, we were at 53.1. This week, we believe will be around 36.1, so it is going down, so that is great. Our positivity rate last week was 10.4%, and we anticipate this week it'll be around 9%. So we're hoping to continue with the downward trend in the positivity rate and case rates. In order for us to advance to the less restricted tier, which is red, if you could go to the next slide. This is where we have to be. So our adjusted case rate needs to be between 4 and 7%. A reminder, we're at 36%, and our positivity rate needs to be between 5 and 8, and we're at 9%. So we're closer to that. And Dr. Ghilarducci can report out a little bit more on this if there's questions around this, but we're hopeful that we'll continue the downward trend and be able to move into the substantial red tier. So just we can keep a track of these numbers, and you can continue to look on the covid19.ca.gov page to see this number. They track it on a weekly basis. Occasionally they update it more often, but you can look on the website and track our county specifically, as well as some of our neighboring counties if that was an interest for you. Next slide. Just a brief update on OptumServe. We are now seeing walk-ins Sunday through Thursday from 1 to 3. So if you wanted to have a walk-in test, you need to just go on the LHI website, register with your number, and then walk in between 1 and 3. And as they have time available, they will pull you in during that time period. It's open for normal business hours Sunday through Thursday from 7 a.m. to 7 p.m. And we've been seeing about 125 appointments a day. Unfortunately, the data pool wasn't available to say how many cases we have seen. Like I normally report out a collective number, but I wasn't able to get that for today, so I apologize for that. So now I'd like to turn over the rest of the presentation to Dr. Ghilarducci and Dr. Gellert. They are going to be providing information on our vaccine distribution plan and update. Clerk of the board, if you could let Dr. Ghilarducci share his screen, that would be great.
Good morning, everyone. Thank you for having us on here. So I wanted to give a little more clarity on our vaccine progress and a couple of caveats. One is, first I'll start with saying that we obviously get a lot of questions about where we are on the vaccine schedule, on the phases and tiers, and I hope that this will provide some clarity. The other thing, this is based on raw data from the California Immunization Registry, and this is data that was provided to me over the weekend. It's filtered for San Benito County, and I will say that the state is still working on data cleanup in their overall registry, and so the numbers that they report on their website may not match exactly the numbers that were provided to us. They're continuing to work on that, but I just want to make sure that people don't get too hung up if there's a little mismatch between the two different sources of information. So with that said, we are looking at, let's just take a look at received and distributed. You just saw this screen, so I'll pass through that. Looking at doses administered, this is total doses we estimate to be around 2,639. Most of those are first doses. We've started to work on second doses for people as the timing has come up. We've managed to be able to get second doses to people when they were due and not have any delays. But obviously, it's a bit of a logistical challenge to make sure that we meet two criteria. One is that second doses are available, but secondly, that we don't hold a whole lot of vaccine in the freezer because it doesn't really do anybody any good if it's sitting in a freezer. So we also want to get it out the door. So it's a balancing act between the two, which is complicated by kind of uneven distribution from week to week, not knowing exactly how many we're going to get. So far, we've had about 3,400 San Benito residents vaccinated. A fair number of those two numbers don't match because a fair number of San Benito residents have been vaccinated outside of San Benito County. And that is something we would expect if they're going through their normal healthcare providers or if they happen to work out of county and their employer vaccinated them there, especially for healthcare workers. We've had about 537 non-San Benito residents vaccinated in San Benito County, and that's largely due to the Phase 1A, which are workers that live elsewhere but work in San Benito County, and so we would expect that to happen as well. Next slide shows the daily doses provided over the past couple of months in San Benito County. You can see a very slow start initially. I'm encouraged by the upward trend of this number, and I hope to see that continue. In fact, I hope to see this climb happen very sharply as more vaccine becomes available. This map just shows where our vaccines have been distributed, and again, a kind of wide dispersal, but obviously most of them in San Benito County. The counties, the residents of people who were vaccinated in San Benito County that live elsewhere, or San Benito County and other counties are listed here. Mostly Monterey County, Santa Clara County, Santa Cruz, but even as far away as Los Angeles, we've had folks that live in these areas be vaccinated here in San Benito County. Again, a lot of these could be Phase 1A healthcare workers. Unfortunately, the immunization registry does not record occupation in there, so I don't have any way of verifying that through that registry. So where are we on the phases and tiers? And I think this is probably the most important slide today, is looking at this. And as you know, we've been focusing on, after the Phase 1A, of course, focusing on the age-based allocation that's directly tied to reducing deaths and to preventing hospitalizations. And we know that those that are 65 and older are at the highest risk for that. Obviously, there are people that are younger that are getting very sick, and some of whom are dying from COVID. And for various reasons, sometimes pre-existing conditions, other times it just happens. But the right now the focus is on an age-based allocation. We're really focusing on our 75 plus, those older people, 75 years and older. And you can see we're making some pretty good progress where we're at 41% of that group has been vaccinated, some in the county, some out of the county. The next group, the 65 to 74, we're starting to chip away at that number right now at 7%. That's a much larger population in San Benito County, so it's going to take a little more time to get through that. And then, of course, the less than 65, largely phase 1A people that have been vaccinated fall into that group. This is the distribution by clinic, and as Tracy said, we're going to be probably posting this information on our website pretty soon, but you can kind of get an idea of the scale of vaccinations across the different clinics that do provide it in San Benito County. And this is the age distribution based on clinic. So the green is the 75 plus group that we're looking at. The orange is 65 to 74, and then less than 65 is the blue. You'll notice that some variability across there, and largely this has to do with again phase 1A. There was some discussion about other allocations elsewhere, but just gives you an idea of where the distribution is. And then the final piece, looking at race and ethnicity, and this is very important to us in the health department, because we know that those who do have access to health care also have access to vaccines through other sources, through their primary care providers, usually through these multi-county entities like Kaiser, Sutter, Dignity, and others. So we want to make sure that we have special effort directing vaccine to those who have lower access to health care, and making sure that they have the opportunity to get vaccinated. That's particularly important because it's these populations that have been most affected by COVID as well. So looking at our data, we can see that if you break it down by ethnicity, the Hispanic and Latino community versus the non-Hispanic, non-Latino versus a large group of unknown, that is where ethnicity data was not put into the registry at the point of vaccination, so we just don't have that information. But if you look at race below that, you can see that it's predominantly white. The other race the other race category includes Hispanic population, which is a large part of our community, and then other groups after that. So this is a little bit concerning because we're seeing, maybe continued inequity to folks that otherwise have pretty good access. I will say, though, that some of this is a little bit confounded by the fact that phase 1A is a large part of this group. And so that wasn't based on ethnicity, it was based on whether you're a healthcare provider. And so I think going forward, we're going to be continuing to look at these statistics to make sure that that we continue to have an equity focus going forward. So that concludes my part of the presentation. Thank you.
Thank you. Any questions for the doctor? Start with Peter. Any questions for the doctor, Peter?
Yes. Thank you for that presentation, Dr. G. I had a question about the access. You mentioned the equity element. So and I don't see the slide, so it's off the top of my head, but I know it was Dr. Bress, and I want to say CVS. It seemed like they were the ones that were able to get the 75 and older vaccinated the most. That's and it seems like they didn't have any of the 65 and younger or any. So, what is the big distinction there, Dr. G, and why is that evidence? Is that proof basically that you have easier access through these agencies that are basically folks that have health insurance versus the folks that don't have the access to health insurance?
Yeah, so I think this data is helpful. This is the slide again that you were referring to, Supervisor Hernandez. Is that correct? Yeah, and we have reached out to our providers and asked them to focus on the 75 plus group, and you can see that that's largely been done in most of our providers. But others we've asked to reach out to in-home health services who are going to represent a broad range and broad ethnicity as well. As we go forward, of course, we're going to be shifting the focus, and we think that actually, and I'm going to go back to this other slide, this one that I said was probably the most important one. At some point, we're going to need to roll over to the rest of Tier 1. This is Phase 1B, Tier 1, which includes a very large group, the 65 and older, as well as 3 specific occupational groups, or broadly defined occupational groups, the education and childcare, emergency services, and agricultural services. And that is going to be a lot of people. Obviously there's a broad range of ethnicity and access across those groups as well. Some have insurance, some don't have health insurance. So the reason I bring this slide up, though, is that when we get to the 50% mark on the 75 plus age group, so when that blue bar gets up to 50%, we think we're at a position then to go ahead and pivot and open up to the rest of Tier 1, including the 65 plus and the 3 occupational groups. Now, there is a downside to that. The downside is that there's going to be a lot of people competing for a small amount of vaccine. And we recognize that, but we also recognize that that all of these groups are very important and in many ways probably have the same sort of deservedness of being vaccinated as soon as possible as the others. So it's going to be a while before we get through Tier 1 just based on the size of the group. We hope, again, as I say, that the rate will increase going forward, that more vaccine becomes available. We also are going to, with the proportion of vaccine that the health department is going to be performing directly, we will try to target groups that otherwise have difficulty accessing healthcare. But all of our healthcare partners have been very good about reaching out to the groups that we've asked them to, and they've, like Dr. Brest, for example, he's one of many examples, has reached out beyond his normal patient panel to provide this service to the community. So really, this is a collective effort that we thank them all. But we're looking forward to getting to that 50% mark for the 75 plus. We think that'll be probably 1 to 2 more weeks. It's about 200 to 300 people to get to that 50% mark. Obviously, there's others in the 75 group that won't have been vaccinated by that time that happens, but we're doing intensive outreach for all of the individuals that we know of in the county to make sure that they know how to get the vaccine and they get put in line and have access to it. So I hope that helps.
Mr. Chair, a few questions, comments?
Thank you, Doctor.
Well, hold on one sec. Anything else, Peter?
Yeah, thank you, Mr. Chair. I mean, so on that note, it sounds like, well, to a certain extent, it kind of begs the question that if there's such a focus on the age range, and this is obviously statewide, how does that not make it a disproportionate outcome for the sensitive populations, for the Latino, for the folks that don't have access? And then what other, it's 2 parts in my mind. So what is the issues as far as engagement to make sure that the underserved populations have fair notice to make sure that they get in line to get their vaccinations based off of their tiers?
Yeah, those are great questions, and I think Director Belton could probably add quite a bit to this, but I'll say that it'll largely be targeted outreach to those that have, difficult access. So we're working with shipper and grower. We're working with, various industries that may employ these, and then also with community groups such as LULAC and so forth to target outreach to those groups.
Thank you, Mr. G.
Supervisor Tipping?
Yes, thank you, Mr. Chair. Couple comments I wanted to make. Well, first of all, I wanted to just say what an amazing job that I think that County Health and Tracy and Lynn and 2 doctors, everyone is doing. It's the tremendous amount of work trying to stay on top of this, and I think they're doing an outstanding job in a very difficult situation. One thing I wanted to emphasize, and again, I'm on this ad hoc committee along with Supervisor Kosmicki, is, you know, the great shortage of doses that we have of vaccines. Within San Benito County, just roughly speaking, I think we're probably receiving at best half of what other counties like Santa Clara County are receiving to this point. It's probably less than half. Part of it is the way that the state has rolled this out initially, focusing on, thank you, focusing on providers and large providers in particular. So if you think of Santa Clara County with providers like Stanford Hospital and Medical Center, Kaiser, et cetera, compared to San Benito County with much smaller providers, the way the state has rolled it out, I think it's unfair, but that's just the reality. So that has put us in a difficult situation. We do hope that it's going to improve dramatically over the next few weeks with some changes I think we've all read about in the paper. And also, I can say that specifically to the that community is so important in our county, the Latino and farm worker community. I know there's been a particular focus in Sacramento. Assemblymember Rivas and Senator Caballero have been working closely up in Sacramento as well as with us locally to try to encourage more vaccines, in particular to help target, you know, that high-risk community. So
Hey, let me interrupt you right there because we have Vanessa from Senator Caballero's office.
Good
She'll
timing.
give you an update on what Senator Caballero is working on. So Vanessa, are you on?
Yes, can you hear me?
Yes, ma'am. Thank you very much for taking the time to educate us on what's happening at the state level. I know the Board of Supervisors, along with myself especially, and Mr. Tiffany just asked, what are we doing so we are receiving more of these vaccines where we're at roughly 3.5 to 4% of our population in comparison to a lot of these other communities that are in the double digits, which just isn't fair. So what is ANA doing for us?
Yes, I just want to, again, thank you and supervisors for allowing me to speak on behalf of Senator Caballero. She did want to be here today. Unfortunately, she had a legislative commitment and she couldn't join us. But I do want to, recognize you all for the hard work and really, during this time, it has been historical time of monumental change. The Senator has been working very hard these past few weeks to address the administration and the distribution of vaccines. Her focus is really to the highlight of the equity issues that have resulted. She's really working on that behind the scenes. As a result, as Supervisor Tiffany mentioned, she did send a letter to the governor for additional support for farm workers. As many of you know, she has been a champion for farm workers, throughout her legal career and public service. Farm workers have been placed at a lower priority tier than other essential workers. And the Senator's advocacy on their behalf is not about skipping ahead, it's about equity and fairness. So she has been, leading the way to ask the governor to up the number of vaccine doses for rural California. She's working with the pharmacies, the drugstores to help vaccinate all of our essential workers. But this must also include our farm workers too. So until this happens, she has committed to not jump ahead in line. She is able to work safely from home, just like I'm working remotely as well. She believes that vaccine needs to be prioritized to those who really can't. She also recognizes that pharmacy deserts are all over rural California. This is why she has been working with other pharmacies and retailers to not only expand location sites, but to also increase their ability to conduct mobile vaccination clinics as well. We also know that the state is getting ready for a new phase to approve additional pharmacies, so we look forward to more information on that. She has been in constant communication with the governor's office, public health officials, county leaders, really looking for a collaborative approach to support the counties.
And again, she's doing everything that she can to make sure that it's done in an equitable way. And then overall, I just want to also mention that California has improved their vaccinations. I know we are now ranking at the 11th lowest among the 50 states. Obviously, we want to do better, but just that's definitely an improvement. We also heard from the federal government, and now that the Super Bowl is over, the NFL has offered 32 of their stadiums to be used as mass vaccination sites. Planning will begin with the county health departments on that. I know for San Benito County, we don't have those mass large facilities, but we're looking at solutions to really look at mass vaccinations for all of our counties. And then lastly, I just want to kind of emphasize, I know we're talking about COVID, but also other legislation she's been working on is, the governor's small business grant programs. And her focus this year will be definitely on the economic problems brought by the COVID-19 pandemic, supporting housing production, supporting the farm workers, and strong environmental policies. So I'll turn it back to the supervisors. If you have any questions, be happy to answer.
Yeah, I'm sorry to be a squeaky wheel here, but everything you said was not really referring to what we're going to do to make sure we see more than 4%.
Sorry, I'm having trouble hearing.
Oh, I'm sorry. Sorry to be such a squeaky wheel here, but our problem here at San Benito County is we are only...
It's really hard to understand you, Mark.
Well, someone... Who's got their...
Vanessa, maybe you can mute your line.
I'm muted. Is that better? Oh,
Yeah,
sorry
it was Vanessa's line,
sorry
I
to be
think.
such a squeaky wheel here, but the problem we have here isn't we don't have places for mass vaccinations, or we don't have places we can vaccinate people. We don't have the vaccines. We're only at 4% in comparison to some of her other districts and some of the other cities or counties within California that are in double digits, and we're at 4%. So that's what we're trying to figure out is why can't we be in the double digits in comparison to our population like everyone else?
Yeah, and so, thank you for that. So this is something definitely we're looking into, and we're aware that, we want to make sure that we get more vaccines. And so that's been the push that she's been, working on. So, again, thank you for bringing that up. And I know that's been the biggest issue, so that's what we're definitely working on.
Okay, thank you very, very much. Mr. Tiffany, I know you kind of I interrupted you, so.
No problem. Thank you. And I just reiterate what the chair just said. The driving force here in our county is not the lack of ability of getting vaccines out there, whether it be through not having enough providers or such. The driving force is we have a great lack of vaccines, period. And so that, we really need to emphasize that. And given the circumstances, I think the county has been doing an excellent job, but we simply need more vaccines. A couple other points I wanted to make, and then I had a question for Dr. G. I think when you're looking at the statistics, you saw a certain number of outside of San Benito County residents getting doses outside San Benito County. While we are certainly getting as many vaccines in the arms of our residents as possible, let me just mention that if you are in a position of getting a vaccine outside of the county, maybe you are a patient of UCSF or Stanford Medical Center, or you have been in the military or some other means, by all means, please take advantage of that. So if you go outside of the county and get your first vaccine and it's inconvenience, my understanding is we can make arrangements for you getting the second vaccine here. But the point is, don't hesitate to go outside of the county if you can get it. I think myself as well, I know all of us up here have been getting emails and phone calls about why is it that my neighbor or my friend or my cousin in Sacramento or in San Francisco who's just over 65 got a vaccine, and I haven't gotten one here. And again, there, as we've been saying, there are other areas that certainly proportionally are getting more vaccines. So it's unfortunate, but in the meantime, take advantage of that if you can. I just wanted to emphasize that. Also, I wanted to point out, because this was something that I asked in the very beginning when I first got involved on this committee. If we have, I think, currently 6 or 7 providers, and let me use the example of Dr. Bress or Lucky's Pharmacy. The question I asked was, okay, if I'm not a patient of Dr. Bress or I'm not a customer of Lucky's Pharmacy, does that put me at a disadvantage in terms of getting a vaccine? And, you know, the answer is no. So the county health department, Tracy, Lynn Mellon, their group are doing a very good job of coordinating all the providers, making sure that they go. At this point, it's been primarily age-focused, as Dr. G was pointing out, 75 and older, and starting up in the age 90s and working their way down, but making sure that it's coordinated between all the providers, so that if you're not a patient of one of those providers, then you're going to likely get your dose through maybe Hazel Hawkins or through the county health department. The last 2 Fridays, we've had 100 vaccines given by the county health department, and those are some of the people, again, that were maybe not patients or customers of those other providers. So I just wanted to reassure the public that you're not going to fall through the cracks in that area. And I will say that if you are of an older age and you haven't gotten the vaccine, if you're the upper 70s, in your 80s or 90s, and you have a question, certainly reach out to myself, or I think I can speak for Supervisor Kosmicki. And if you're having trouble finding out information, get in touch with us and we'll see what we can find out. The county health department is getting upwards of 300 phone calls a day on vaccines, so it's extremely difficult to. They're answering those phone calls and getting back people, but again, if you're not getting good communication, let us know. And then just a question I had for Dr. G. Do we know, or maybe this is for Tracy, do we know how many of our 75 and over people have registered, or for that matter, 65 and over have registered? There's a registration that people go in, and I know that's being used to go down the list. Do we have any idea what percentage of our population has registered at this point? And of course, then it begs the question of how many people have not, and maybe we're missing them. That's just a question I have. Thank you.
Tracy?
I think Tracy might be able to address that. Yeah.
Yeah, so we do have on our interest portal over 9,000 inquiries and interests on there. And so we're trying to sort them by age prioritization. And I just wanted to kind of highlight a couple of things that we did talk about, and I can kind of talk a little bit about numbers too. In regard to the vaccine availability and supply to our county, we as an agency have met with Senator Caballero, Assemblyman Rivas, and also Congressman Panetta to engage them in their efforts to help secure more vaccine for our county. So we are actively engaging with them as well, as Vanessa reported. There are also a couple things that are changing within the state. I'm sure some of you have heard about a platform called My Turn, which is a statewide platform that is similar to our interest portal. We created the interest portal as a bridge before this platform becomes available. We have had our onboarding conversations with My Turn for our county. So eventually we will shut our portal off and have individuals register through the My Turn portal. And you actually schedule, not only express an interest, but you schedule your appointment through My Turn with one of the providers available in the county. We're hopeful that that will go live in the next couple of weeks. There's also a third-party administrator that the state is working with, which has been identified as Blue Shield, and they, moving forward, will be the ones to allocate the vaccines to the provider. We haven't got any updates on exactly when that's going to happen, but it is definitely in the works with the state. That we have also worked with, as I believe Supervisor Kosmicki or Tiffany indicated, that we've been working with different entities regarding the industries that are in this next phase of our tier. We've worked with Grower Shipper, which I think Dr. G mentioned, and they have connections with a lot of the farm labor communities. We've had conversations with LULAC. We've had conversations with the Health Foundation about how we can outreach and get these individuals in the food and agriculture industry vaccinated. And so we are running these conversations concurrent with the current prioritization of 75 and older. So we hope, as Dr. G expressed, to advance to this tiers in the industry tiers, as well as the 65 and older within the next week or so. We just, as he indicated, there is going to be a shortage of the vaccine and not a lot available, and it's a big tier. And so there's a lot of individuals. And so figuring out the demographics on how to do that is what we're working on concurrently. Just so you know, our partnerships with the providers, what we've done with our interest list is we've shared the list of people interested from oldest to youngest with the providers if they've been identified as a provider. And as Dr. G also indicated, several of the providers, Hazel Hawkins, Dr. Bress, PCA, feel that they have tapped into their 75 and older and have pulled from our list of individuals in our community that are 75 and older that do not have a listed provider that's a vaccinator, and as well as some of the pharmacies, I apologize. And we have provided them a list of names of individuals within that prioritization to start vaccinating so that we can get to that 50% of 75 and older. On the list of 65 and older, I don't have that data at my fingertips, but our analysts could definitely run that data for you. It is a very large group. I would say probably the majority are 65 and older in that list. And so, you know, we're still trying to plan on how these points of distribution will work for those industries. We would be happy to report out more numbers at the next meeting or even in our ad hoc committee on where our numbers are with that, but I just don't have that readily available at this time. Outside of that, I think that was all I wanted to kind of touch on as far as our next steps. If there were any other questions about any of those things, I'd be happy to try to answer them.
Anything else, Supervisor Tiffany?
One last question, Tracy. As we pivot to the 65 and older, as well as the three industry groups, including the farm workers, ag group, will we remain focused on the 75 and older? I know we're maybe pivoting at the 50% level, but I would assume we would continue to work our way down age-wise. Even though we're 65 and older, we're still going to be focused on the 75 and older as far as the age component. Is that correct?
Once we get through 50%, we feel that it will be safe to open it up to 65 and older. Just in general, we won't be able to prioritize anymore off of that age because we feel that we're at a safe place being at 50%. I did just get the numbers. So on our interest list, we have 9,600 completed forms and 5,500 are 65 and plus on that form. So the others, I think it's safe to assume are industry-based. So the industries that were identified in the phase 1B, tier 1, which is food and ag, emergency services, and education are the three industries that are in this tier.
Okay, thank you.
Supervisor Gonzalez?
It's not that I have some questions, maybe just kind of concerns. I do attest that the county portal, the interest portal, is actually working as suggested. My mother is in her 80s and she received five phone calls regarding the vaccine in terms of, I enrolled her in the portal as soon as the county made it available and from her various doctors and providers. So it is a mechanism that's working. It is the problem that we don't have enough vaccines to go around, and so that's a significant issue. But I thoroughly thank the ad hoc committee, Supervisor Kaminsky, as well as Supervisor Tiffany, on what you're doing. The only concern I have is how can the public get more information regarding this. It seems like there's a lot of work being conducted, but because we're not disseminating that information on a regular basis to the public, it looks like we're not doing anything, and that's not the case. It sounds like you've been very, very busy, very thorough, contacting all of the elected officials, Caballero, Rivas, as well as Panetta, to see why can't we get more than the 4% that we're receiving. So I commend that, but I just ask that the public be a little bit patient. We're all in a place where many people want and need the vaccine, but there just isn't the supply there. And so I just thank you for all the work. But I encourage you, use that portal. It is working, and thank you. Thank you.
Supervisor Kosmicki?
Yeah, thank you, Mr. Chair. So first off, so the public's aware, I've, working on this vaccine ad hoc committee, I've made it very clear that the two primary issues that we're dealing with here are, and I try to think from the public's point of view. We all get a lot of phone calls on this, a lot of emails and social media contacts. And I absolutely sympathize with the public on this, that, it's a very, very frustrating, confusing time. So I think despite our challenges, and I've emphasized this to staff, that we really need to really focus on clearly communicating what we're doing and making sure that we have, as far as the logistics go, so that we can prevent angst in the public's viewpoint, make sure that we have really firm plans in place logistically for the event when we do inevitably get these doses. So I just want the public to know that we are working hard behind the scenes on having these plans in place to what I've referred to as a hybrid approach to the distribution, which I'll get to a little bit in a bit. But secondly, that we communicate very clearly with the public. And so real quick first, though, the shortage issue. This is something that really jumped out to me, and I know Supervisor Tiffany and others weeks ago when we started to really look at the numbers. You're hearing all these complaints, but when it really comes down to here is that the state has failed miserably in the most monumental of moments where we needed the state to step up and be equitable and do the right thing and put politics aside. The state has failed this community, and I want to make that very clear to the public. I do have a question before I go on, and I don't know if we have the answer to this. It's my understanding that the distribution of these allocations is not based on the most logical methodology that you can think of, which it should have been based on, which is population. And so I don't know if Dr. G or perhaps Vanessa can answer this question. What are the county-by-county dose allocations actually based on?
Yeah, thank you for that question. It's a great question, one that all of the public health officers and health directors have asked the state. There is, I think population is part of it, but really it's a black box. I think one of the reasons there's a big maldistribution across counties has to do with this MCE issue. Those counties that have MCEs, there's a big allocation that goes to each MCE, and then the MCE decides which county to send it to, and that's something that we don't have any control over. So that's a kind of uncounted source. The other source is the federal pharmacy partnership. So those who have a lot of skilled nursing facilities and so forth may have gotten an allocation through that avenue that is otherwise kind of blind to us on how that happens. So there's, we've asked for the formula and have yet to receive it.
Excuse me, for the education of public and maybe most of us, MCE, can you explain what that is? I had that same question a few weeks ago.
Oh, yeah, I'm so sorry. MCE stands for multi-county entity, and those are large healthcare providers that have a footprint in more than one county, like Kaiser, Sutter, Dignity.
And if you could clarify, we don't have any MCEs in San Benito County. I think that's part of our biggest problem here is that, I think when you just look at the public health distribution numbers, when you do the math on a per capita basis, we're shortchanged on an extraordinary level when I do the math. But then you throw in this additional factor of these hidden pathways, is what they've been called, these numbers that are, there's a gray area here, and it really exacerbates the issue for us, because we're not only getting shortchanged by the state on a population basis with our distribution to our public health department, but then there's no consideration of the fact that we don't have any MCEs in this community. And if you are going to stray away from a strictly population-based methodology, it would seem to me that communities that are hit hardest by the pandemic would be the ones that would be prioritized over other communities. Communities with more of a Hispanic and farm worker population would be prioritized over other communities. And in fact, it seems to be the opposite. And so it's extraordinarily frustrating, especially when the public is asking us for answers and we have to tell them that we don't have those answers. I think it's just an absolute embarrassment, you know, I think from the top down at the state level. I don't blame our assemblyman and our state senator. I know that they're working on this, but I do want to really underscore, Vanessa, I appreciate you being here. If you can take this message back, that we are simply not going to sit back and allow this monumental travesty to take place. I am not going to sit back and allow this as a leader in this community to just say we don't know why we're not getting an equitable distribution of a vaccine in these historic times, when of all times the state should be equitable. It's now. Of all times. And they're not. And it's disturbing to me. And so I'm looking for answers, and I really, I'm asking and urging you, Vanessa, I appreciate again you being here, to please find answers for us as soon as possible, and to continue to have Senator Caballero advocate for us at the state level, and I know Assemblyman Rivas is doing so as well. So that sort of leads me into my primary concern here, is that, and I do have a question, Dr. G, you had put up that graphic showing that Caucasian residents were receiving doses at a larger proportion, and I do understand you mentioned that part of that has to do with that phase 1A, that we were vaccinating our medical care workers. Can you please clarify, maybe it's just an anecdotal observation because perhaps there isn't a precise answer to this, but how much of that discrepancy has to do with perhaps the fact that there may be more Caucasians in the medical field versus an inequitable distribution, for whatever reason it might be, to our Hispanic community?
Yeah, it's a great question. You know, to the extent that there's disproportionate representation in the healthcare provider community, I don't have that data at my fingertips, but I think that's partly what we're seeing. But I think the other effect we're seeing, and I showed you some numbers that showed the number of people getting vaccinated out of the county. People with resources are able to navigate websites. They're able to drop what they're doing, jump in the car and drive to another county to get vaccinated. They have the wherewithal to find it and to be able to, the flexibility and the transportation to get there. And so I think that's part of why you're seeing these numbers being disproportionate this way.
Thank you for that. And so just to update the public, I want the public to know, and I know Supervisor Tiffany has expressed this as well, and we've had these ad hoc committee meetings, and I know our public health staff has underscored this, and our administration, is that we understand that, the last time I looked, 80% of the population of residents with COVID-19 in our community were Hispanic, and we do need to ensure that, and we are emphasizing this in our planning, and there was some talk a little bit about our discussions with grower shipper and ag institutions and LULAC. We are emphasizing, despite what's happened, I'm not going to beat around the bush here, but despite what's happened with the Health Foundation, we have emphasized in our meetings, this has been a top priority, that we absolutely have to make sure that our distribution of this vaccine is equitable in our community, and that, to whatever extent possible we need to do outreach to the Hispanic community, the farm working community, because I think we all know that with farm workers in particular, they were hit particularly hard during this pandemic, disproportionately so. And there are, a lot of concerns for me, of a lot of people in our community that maybe farm workers, and then they go back home and perhaps are living in more crowded housing situations, and that in itself creates additional problems with the transmission of this virus in our community. So I do want the public to know that it's a priority of mine, and I know it's a priority of my colleagues, to ensure that we are having plans in place to adequately serve our Latino and farm working community. And then as far as, I said earlier, logistics and communication. And so with logistics, I just want the public to know that, despite the fact that we have this extreme shortage of the vaccine, when you do the math, you're getting 500 first dose vaccinations in a week. I mean, it would take us a year and a half to vaccinate the entire community. So I think we all know that that's not sustainable. We need more vaccines, and that's the biggest problem. But as far as the plans moving forward, we're working on mass vaccination clinics, which I think is a great thing. We have, it's a hybrid approach. So you have mass vaccination clinics, you have a limited number of outside distributors through pharmacies, clinics, and doctors' offices. And then we have these remote clinics that we are in talks of having with our agricultural institutions to make sure that our farm workers are adequately vaccinated. And then, I've emphasized as well that we should have additional outlets to make sure that we are vaccinating our Hispanic and farm working community through clinic situations. We're trying to work through the issues with the Health Foundation. We're hopeful. I think we all know the importance of the Health Foundation and the value that the Health Foundation has in this community, as far as ensuring that our most vulnerable residents are served. That is a top priority. We are hopeful that that will work itself out going forward. And if it doesn't, we are working on contingency plans to make sure that our Hispanic and farm worker community is served through clinics. And then also, I just want to add, I've gotten a lot of concern from residents about our education sector and making sure that our teachers, we can't forget that our teachers are in this next tier. And so I have had some discussions, and I've emphasized this with our staff, that we also need to make sure that we are planning for a strategy to vaccinate our teachers, and perhaps it's been discussed. I just want to be as open with the public as possible, because I think in these times, if normally you might have inside conversations, and I've said this to staff, and with other issues, maybe those things can be put on hold until you make the official announcements. In these times, I think we have to be open throughout the entire process with a lot of these logistical issues. So I'll be honest about, what we mentioned before, grower shipper, but we've also, I think we have to have discussions with our schools, our school districts, about holding clinics and holding mass vaccination clinics, using those partners, because to me, they're willing and ready to go to help us out, use their school nurses, use their staff, and hold clinics at schools as well, what we've called pods. So I just want for the public's, to really kind of try to, again, reduce the public angst here. We are putting plans in place to handle the surge in doses. But I do think and I've made this clear, we have one public information officer. He's doing a lot of work. I think he's done, a great job at getting information out. But we need to, I think we as a board of supervisors and as a staff need to do a little more as far as narrowing the focus and making sure that we're communicating on a daily and weekly basis in a way that is coherent, and the who, what, when, where, why sort of answers that the public is looking for. And if we don't have those answers, we just have to be honest with them and tell them, look, we are only getting 500 doses this week. We've got to get through some of these 75, 80-year-old folks, and we're working our way down the list. And I do think at some point, and maybe it's not right now, we have the third-party administrator coming in. Blue Shield's going to come in, and we don't know exactly what they're going to do. But I, as one supervisor, would like to see, once that occurs, I would like to see regular updates to the public, giving them the best available information on timeframes, when you could potentially expect this tier and that tier to be vaccinated. And at the same time, being very clear with the public that these are fluid schedules, that none of this is set in stone, but this is our best guess, our best estimate on, and keeping in mind that it might change, that you may get vaccinated at some point. People want to have some level of comfort in knowing these sort of key answers. And even if we don't have the answers, we need to tell them that. I'm sorry, I'm going a little long here, I apologize. But I also was wondering on I brought up in the past, we put some funding aside for outreach. We put $50,000 aside, and I know we have sort of internal casual conversations here and there, but once we get this third-party administrator on board, especially, I think we have to think about putting out a mailer to the entire community, every household, that explains where we're at, as far as the vaccine goes, how you get a vaccine, the FAQ sort of stuff that I brought up, the key questions that I brought up. I personally, and I know there's 5 of us, but I would urge us to really do that, to get a mailer out to the entire community, because I think, one of the biggest problems we brought up already here is that not everybody has internet access, not everybody is on Facebook, not everybody wants to sign up on a portal. And so I also would emphasize that we should really stress in our outreach that you can sign up on a portal, but you can also sign up using the public health hotline. And I think that needs to be in our materials so that people can simply call that I think it's 6364113 number and sign up for an appointment.
That part right there with the mailers, that's within your and Bob's call on the ad hoc committee. So please use that.
I appreciate that. And then we've talked as staff. I want the public to know we have a growing list of volunteers, and I just want to urge us to really. I know our public health staff has done a tremendous job. The public doesn't really understand fully the level of work that's been going into this, but I know they're working on, dealing with the volunteers. But if we can get an update at some point on how we're dealing with that long list of volunteers and what they might do, I think about answering phones. We've talked about answering phones. We're getting all these phone calls, and maybe we can have some of these volunteers trained so that they can, take some of these phone calls and take some of the burden off of our staff. I think that's all I have, Mr. Chair.
I'm going to go back to Peter. I know you had a question, Peter.
Yeah, thank you, Mr. Chair. So my comments I'll try to keep them brief. So in general, I agree with Supervisor Kosmicki on what he mentioned as far as the issues with the state. I just had a conversation yesterday with a family member who works in the industry, basically in Santa Clara, and it begs the question how these distribution issues have happened throughout the state. One of the things that came up was Fresno County is another one, which is high ag worker community also that's dealing with the same issue. So the long and short is the distribution process has been disproportionate to the Latino or ag community. And so I agree with Supervisor Kosmicki that there needs to be an equal distribution, that it needs to be population-based. I'm hoping that we partner with the Health Foundation, that we actually, and I really don't like that they've been demonized. I think that we need to support them and not have a negative, to the network that ultimately has a strong relationship with the Latino population. They're the ones that have the network. I would piggyback a little bit to a certain extent on what he mentioned as far as how, because really this has got to be it's like starting a new business is literally creating a network locally. So in my mind, what's been mentioned actually is reflective of a greater sense of local control, because I know the way that this has been managed has been all at the state level with engagement on the locals as far as what to do or how to do it, but not necessarily or with the input of how our demographics are and the issues in our own community. It should have been a focus to ultimately go after the Latino population, since if you look at the Health and Human Services website, I mean, they show 75% of the population that have been impacted is the Latino community. It's the Latino male that has had the highest morbidity rate. So for us to not have a conversation about focusing on the highest risk and trying to bring into the fold the Health Foundation, I don't think it's wise. And I'm not saying the county is doing that, but messaging is very key. I think it should have been an internal conversation about how to engage the issue before it got public. And I see this is actually, it's discouraging in the sense that we haven't had that conversation, so that we do create a unified message and ultimately restore the trust to the public. So with that said, Mr. Chair, I and I know it's item 9, but that's why I think I would like to be on that vaccine ad hoc, and it'll be it's just my quick pitch, because the reality is there needs to be ongoing conversations with the Latino community, and I think I'd be able to do just that. So, we are the 41st in the state to receive the highest level of vaccines, and we're almost the worst in distribution. It sounds like things are getting better. We don't, when it comes down to messaging, I agree with Supervisor Kosmicki. We should do a mailer. I think there needs to be an involved effort to make sure that we bring into the fold the Health Foundation to figure out that network and ultimately understand how to engage those folks. Because I called Vivian myself and had a good conversation with her, and it's not as simple. The issue with the people going out of turn. There's vaccines that can't go to waste. That's a state expectation. Sometimes you can't get a hold of people. People reject vaccines for personal reasons, or they're hard to reach. They don't have access to health care, as Dr. G has mentioned. So the bottom line is it really is, to a certain extent, indirectly, the conversation is, it's desiring by default for a local control, ultimately the local leaders, to figure out something with the help of the state to make this happen a lot more successfully. I feel like that's the only way this is going to happen, is if you actually create your own local network and then work with the state on making this distribution happen better. Outside of that, we're going to have disproportionate issues, because we're pretty much just deflecting to what the state says, and by default, we become part of that failed process. Not that that's the intention. I know the Health and Human Services is working really hard. I believe everybody's working hard, but if you don't have a successful system, you're not going to have a successful distribution process. Thank you, Mr. Chair.
Oh, thank you.
Mr. Chair, can I make a couple additional comments?
You already spoke. I was joking. Go ahead, Supervisor Tiffany. Had to break up the,
Thank you, I agree. Let me just emphasize once again something that Supervisor Kosmicki just said, and to address a couple comments by Supervisor Hernandez. We are in, active discussions with the Health Foundation, and we certainly are trying to work that situation out. I don't need to tell anyone that this is an incredibly difficult time that we're all living through, and I think we all agree that the last thing we need is another issue that is divisive within our community. And so, I feel very strongly, I know all of us feel strongly that we would very much like to get beyond this issue with the Health Foundation, partly because it's such an important, to get beyond the divisiveness, but also because they do play a key role in serving that community, the Latino farm worker community, that's so important. With that being said, I just need to emphasize that in our conversations, we do need to reestablish a level of trust between the county and the Health Foundation. And it's not really just between the county and the Health Foundation, it's between the community and the Health Foundation. And I want to emphasize that really the issues that initially came up were not driven by the county. They were driven by community members that reached out to us. And so I think there was an obligation that we address those concerns so that we can reestablish trust with all parties involved. So I think it is, but like I said, I think it's definitely critical that we try to get beyond that. Whether or not we can, and I'm certainly hopeful we can, as Supervisor Kosmicki said, we are actively discussing, other ways to approach that community. And we've been in active conversations with Senator Caballero and Assemblymember Rivas over the last several weeks. And, you know, our position is that when the quantity of doses ramp up, and we're very hopeful they will in the next couple of weeks, particularly for that high-risk community, that we will be ready. And I just want to emphasize that, you know, some of the comments we made earlier, I think from the public, implied that we're not getting doses or vaccines in the arms of San Benito County residents because we're not prepared. That could not be further from the truth. We just don't have enough doses, and I think Supervisor Kosmicki made the argument very strong and forcefully, and I concur with everything he said. So anyway, the point I want to emphasize is that we are definitely in conversations. We hope that we can get beyond this issue and move forward as one community. Thank you.
Okay, so the vaccine part, we'll kind of roll this up. I just, you know, want to do a quick synopsis. One of the things I'd like to see if we can do, it's more symbolic, but I think it's important. If we can put together a letter and send it to the governor that we do need and we want, because it's fair, not because we want more than anybody. We want our fair share of our vaccines. The second one? Yes, we'll all sign it. Everyone will sign it if you feel comfortable.
No, yes. Definitely.
The second thing is, the best way to illustrate this, in my opinion, is we have the vehicle, meaning I think we do have the infrastructure with LULAC, with grower shippers, with a lot of local doctors. We thought about using the fairgrounds as a drive-through. We have the vehicle. We just don't have the gas. That's why I'm asking, desperately asking, our state senator and our assembly member to lobby on our behalf, to ask that governor, to ask for more vaccines. So I respectfully ask Senator Caballero and Assemblymember Rivas for your help. So I think that sums it up, unless I missed anything, anyone? On the vaccine part, I'm sorry. We're not done with this yet.
I'd like to add one more thing, Mr. Chair, if I may. I know that there was some concerns about education, communication concerning the vaccine. So that's one thing that we will work with. I'll work with staff on making sure that happens. I do know that we have preliminary plans for a Monday and Friday outreach to the community, every Monday and Friday. So we're working on that to try to address some of those issues that Supervisor Kosmicki just mentioned.
I hate to be so demanding, but we need that letter by tomorrow morning.
We'll get that letter.
Yeah.
The letter to the governor.
Yes.
And I think
If I have to, I'll hand carry it up there.
to reiterate, I think as Supervisor Kosmicki said, a mail piece I think is really critical. I realize it is you know, has been pointed out, very fluid, and the concern is we don't want to send out something and have it dated you know, 2 days after we've sent it out. But I think as soon as we feel pretty comfortable with the direction of where things are going, we need to get something out in the mail, both in, of course, in English as well as in Spanish, of course.
And I'll leave that on, with all due respect, I'll leave that on the ad hoc committee's decision. Okay,
We'll
we'll go
work
to
on
our
that.
next
Yes.
item.
Hold on, before we go on, everybody else has been speaking about the vaccine, and I've...
Is it in reference to the vaccines?
It's totally about the vaccine. I have remained quiet for quite some time. I, first of all, appreciate the ad hoc committee that is really advocating for the Latino community. I, as a Latina, have been silent because I feel like I'm not trying to push my personal interests, my personal bias aside. So I very much appreciate the two of you really looking out for that population. My next concern goes to the San Benito Health Foundation. Back in January, early January, I was an advocate for San Benito Health Foundation and them getting an adequate voice at the table. And I worked with Ray Espinosa, Tracy Belton, Rosa Vivian Fernandez, and myself, and we met here in the chambers to see how we can work on communications in improving the relationships so that we can make sure that the Health Foundation continues to have a voice at the table. It was then there where concerns were expressed, where complaints came in through the anonymous tip line that the Health Foundation may or may not have deviated from the tiers. So I've been involved with this way from the beginning. Nobody has asked me outright, but I have some information that I'm going to need to share momentarily. But we have to put personal issues aside. We have to put past indiscretions, whoever committed them, and we have to work together. In my opinion, San Benito Health Foundation has proved that they can be an effective vehicle to get mass vaccines out in a timely manner. I've heard reports of them being able to vaccine up to 200 people in one day. And we need to make sure that we do not allow that line of vaccine supplies to cease and stop. I've seen the newspaper articles, I've read on Facebook, and I've heard some of the concerns from the community about a group of people that may or may not have jumped the line in terms of receiving the vaccine. As I said, I registered my mother way early on because she is of that population, but I never wanted to put myself in the middle of a controversy. And so I did not even register myself on that portal because then I didn't want my name on there and for someone to say, oh, well, this is Supervisor Gonzalez, let's push her up. So I purposely left my name off of the list. My mother received a phone call from the San Benito Health Foundation to get her vaccine. I drove her over there. She got her vaccine, and in the process of her getting her vaccine, it was suggested to me that I receive my vaccine. And I said, no, I don't have an appointment. I'm not scheduled. I'm not in the tier. And it was suggested that since I am her caregiver, that I receive the vaccine. I said no twice, and then I said yes a third time. It was in my mother's best interest. I feel shame that I have the vaccine. And I should not be shamed that I received the vaccine. I am sorry to the public that feel like that, or perception that I may have jumped the line. I did not jump the line. It was advised to me by a medical provider to get it for my mother's health and safety. And because of the shame that I feel, I have stayed quiet in advocating for the San Benito Health Foundation. I am not going to stay quiet any longer. That site is doing what it needs to do. It's serving the population it needs to serve. We have to acknowledge them as a county, and we have to move on from this issue. It is tearing me apart. It's tearing our community apart, and we need to work together, all providers. And as this investigation goes on, I don't know the status of this investigation, but I would like for this investigation to be more global. I would like for it to look at all of the providers that received the vaccines and see if anyone else might have deviated from the tier or the guidelines, because I know personally one did. And so let's not point the finger at one entity. Let's put the past behind us. Let's get the resources together, and let's start getting the vaccines. I command that letter. I thank you. I'm so glad that you're suggesting that, Supervisor Medina, because we need to be a united front, a united county, and a united effort to get the vaccines that this community needs so desperately. And I'm going to continue to advocate for San Benito Health Foundation and the mission that it serves the population. It's in my district. Again, I'm not condoning or harping on whatever was or wasn't done, but I'm tired of feeling like I'm stifled, that I can't say anything because I have a conflict of interest. For those of you who know me, there's a concept, I have a law degree, and those who know me, there's a concept of, the fruit of the poisonous tree. I feel like I have dirty hands, and I did nothing wrong. But I feel like I have dirty hands, and I feel like I can't come public and advocate for one organization or a group of people because of my involvement in this situation. And so I'm putting my guilt on the table. I'm asking for forgiveness for anyone who's demanding and wanting an apology. I am sorry, but I was doing it for the right reasons. But I'm not going to carry any burden beyond today, and I'm going to move forward, and I will be more vocal as much as I can, be involved in the other committees. But that's just my 2 cents.
Oh, no, thank you. And, just to wrap it up, since I was the most vocal person with the Health Foundation, I would tell you one thing. I have no problem with them receiving more doses, doing what they have to, but they need to follow the guidelines. That's all I've asked from day one. I've asked not only the San Benito Health Foundation, I did bring up, and Ray is my witness, I did bring up all the people, just like you said. said, you know, what's good for one person is good for everyone.
Exactly.
But once again, all I'm asking for is to make sure that they follow the guidelines that we have set forth. And that's what I'm after.
I guess I'm putting myself in the shoes of the Public Health Foundation, and what is it going to require from this board, from the community, in order for an apology? What is it going to require? Somebody's head on a stake? Because I'm not advocating for that whatsoever. But what is it going to
If
require?
I can speak freely?
Yes,
I
please.
think we've already did. Am I correct there, CEO Espinosa? We did send a letter to them?
Yeah, we sent a letter out. We've asked for some information, and we're still waiting on that. And as soon as we get that, we'll meet. And I think our end goal is that. I think the ad hoc, we've talked about this. But I think the main thing is we need a testament from them that they're going to follow the guidelines. That's really it. I think that at the end of the day, we can move on with this as long as we get confirmation from them that they'll follow the rules and be fair and equitable. I think that's been the underlining theme of our conversation more or less this whole morning, is being equitable and fair. And I think that's really what we're looking for.
Is that pretty, I mean, I know you've been involved.
Yeah, I
Mr.
would
Kosmicki.
concur with that.
Would you concur with?
Absolutely. I think from the ad hoc committee's perspective, and I know Supervisor Tiffany might want to add something here, we want to be partners with the Health Foundation. But what we've asked for some information so that we can clear the air on what occurred, and so that there can be a level of trust moving forward that it won't happen again. And as long as they are willing to do that, then we certainly want to involve them going forward. As long as we have trust and the community's trust that we're going to stay within the tiers, we certainly want to move forward with them.
Okay, now we move away from the vaccinations.
Let me make one last comment.
Yes, sir. Hey,
I'm sorry.
No, not at all.
First of all, Supervisor Gonzalez, I just want to tell you how much I respect your comments and appreciate you saying what you had to say. It is a really difficult situation. Prior to this meeting, actually, Supervisor Kosmicki and I had a conversation, and basically the gist of it is that we really need, for the sake of our community, to try to find a way forward with the Health Foundation, and I think we're probably all in agreement that needs to happen. But I also will emphasize with what Supervisor Medina and Ray said, is that we just need assurances that the guidelines will be followed and we can rebuild that trust again. It's such a difficult situation because we really are talking about life and death for people. And so it's understandable that there's a lot of passion, anger, fear out there in our community. The difference between, an 85-year-old living and surviving the pandemic or not may depend on getting, a vaccine. And if someone, so that's why there's so much concern and focus on equity and fairness with these vaccines, particularly since we have such a tremendous shortage of these vaccines. So, it's a highly charged atmosphere, and I think, given that, I think we can appreciate why there have been such strong feelings made known through social media and otherwise. But with that being said, I would agree. We need to move forward as one community, as one county, and do what we can to get beyond this issue. Thank you.
Thank you, sir.
All right, so if I may, Mr. Chair.
Mr. Chair, can I make some final comments?
Yes, sir.
Yeah, just really quick, and it's just a point of reference, and for the sake of the public digestion, because that's why I made my statements earlier. It's one thing to have a certain idea of how this is going to roll out, and then you create rules based off of that. It's another thing, the actual outcome. My point is when I spoke to my family member who was literally involved in the vaccine distribution up in Santa Clara County, I asked her, I said, do you have instances where basically you have you're about to distribute the vaccines and someone doesn't show up, or they stay on. I don't want, they basically have an appointment and they don't get their vaccine. Do you end up calling other people to basically take that vaccine? And she said, yeah, absolutely we do. These things are going to go bad. She's like, for logistical purposes, Peter, you need to understand, we actually have this expectation that if people are going to come, that's how we have to plan for it. So we basically get the vaccine ready, which is basically they take it out of the freezer and they're ready to inject it. It's going bad after a certain amount of time. So what happens is they're not going to just throw it away. They're going to call somebody else, right? Someone that's maybe in line. And at the end of the day, it's just, her biggest point is it's just not practical to assume that these tiers is actually going to implement in a way that's going to be just cut and paste successful. There's all these variables involved, basically, is your point, in the outcomes. And that's exactly why it's like the expectation from the state was one thing, the actual implementation was another. And I agree with Supervisor Gonzalez. What we need to do is really, instead of, to a certain extent, allowing this divide to happen, we need to figure out how to unite. And I appreciate all the supervisors that agreed. I do agree we should apologize to the Health Foundation. I do agree that we should have some kind of a unifying moment to make sure that we're moving forward and focusing on the Latino population. So I just wanted that as a point of reference, Mr. Chairman.
Thank you. Back to the CAO, Ray Espinosa.
Thank you, Mr. Chair. Yes, so we have 3 more items on this particular agenda. I'd like to invite up Mike Chambliss. He works at our May office.
Oh, point of order. We haven't talked about enforcement, I think.
That's next.
Oh, I'm sorry. I apologize.
There's 3 items within this.
I thought he was saying on the rest of the other items. Yeah, I heard Chambliss, and I was thinking Public Works. Yep. Thank you.
Yes. Yeah. And so this particular item, Mike Chambliss is overseeing the enforcement within RMA. And so he's going to be providing an update to your board with regards to enforcement. So, Mike?
Good morning, Chair. Good morning, Supervisors. I just wanted to bring you up to date on our current activities. As you're aware, on January 15th, you passed the local emergency ordinance providing for the administrative enforcement of both the local and state health orders. We immediately began developing our program over the weekend to be able to hit the ground running on the first Monday, January 17th. We believe we've developed a comprehensive strategy for ensuring maximum public exposure while trying to target the most at-risk industries as reported on in the media, mainly groceries and agricultural industries, with our available resources, which is 1 full-time officer. We prioritize essential businesses in the unincorporated areas where we believe the most foot traffic and also risk of exposure occurs. In the first week, we contacted every market, construction site, and several of the large agricultural businesses in our county. During the second week, a follow-up visit was made to each market and several construction and agricultural sites. All unincorporated restaurants, especially the Great Plate restaurants, received their initial visit during the second week of the program. Additionally, our staff is conducting reconnaissance and other special tasks as assigned. Recently, last Saturday, we contacted the local wineries and provided educational outreach to them during that time. This week and for the next few weeks, we're concentrating on agricultural labor facilities. We're trying to get the information out, ensuring that the operators are providing the PPE that they're required to provide in an effort to support the underserved communities. Just a few numbers to throw at you. We've been in effect this is data as of last Friday. We've been in effect for 28 calendar days. The 6 unincorporated restaurants have been visited at least 13 times. The 5 construction development sites have been visited 13 times. The 7 markets have been visited 20 times. 8 agricultural businesses have been visited 19 times. We've issued 7 citations and 1 warning. And as of last Friday, we've contacted 74 different individuals through the program. I'm available to answer any questions if you have any.
We'll start with Peter.
Yeah, thank you, Mr. Chambliss. My only question is have we fined people through this whole process?
We have issued 7 citations to 2 businesses.
And those were for second or third violations, or?
One business has received second, third, and fourth violations.
And the rest of them were first time?
Right.
Thank you, that's all.
Any other supervisors wish to speak?
Well, I'd just like to make a comment. Thank you for the presentation, Mike. You know, our numbers are coming down, which is really encouraging. They're coming down statewide as well. Hopefully, we're not going to see another spike after Super Bowl Sunday. But anyway, what I just wanted to say is I think that for everyone out there in our community, we just cannot let our guard down here. I'm really concerned that with the numbers coming down a bit, as well as vaccinations, albeit slowly going out there, that there's going to be a natural relaxation and people feeling like we can get back to normal here sooner rather than later. And I think that would be a huge mistake. So I would just encourage everyone to stay vigilant. Our businesses, thankfully, we've been able to open up further, and for example, with outdoor dining for restaurants, hair salons and the like are now able to operate safely, which is great. But again, I just want to emphasize we need to be very careful and vigilant. People should still be wearing face masks when they're out in public. People should be social distancing. There shouldn't be large gatherings outside of your household. We just need to be very careful. So I think the enforcement remains important. There's just really, I think, a handful of businesses that are a problem. And I think that in the beginning, both Supervisor Kosmicki and myself emphasized that the enforcement was in place, the mechanism to address the most egregious violations, whether it be with businesses or individuals, and I think that remains to be the case. So anyway, those are my comments.
Supervisor Gonzalez.
I just wanted to address the one violator who has had repeated violations. Can you explain to the community what is the next step without naming that business? What is the next step? Because if this business is going to be a model for how we move forward, I would like that known to the public. And so can you share that with us?
We are working closely with the county council's office, and I believe if the violations continue, it'll be agendized for direction from the board in a forthcoming meeting to receive direction to take legal action.
Just for the record, will that be a closed session item or open session? Closed session, correct? Because possible litigation, so forth and so on. Just want to be transparent.
Yeah, thank you, Mr. Chair. Just real quick, you know, we all anecdotally still hear, I think, issues here and there, and I think the enforcement ordinance has worked, just sending that strong message to the community. I think a lot of people really appreciated having that message out there. You know, I do occasionally get, and I've brought this up with our CAO, I do occasionally get some concerns in certain stores. As we stated early on, I think for me, and I know Supervisor Tiffany shared this, one of our larger concerns was the bigger stores and making sure that, you know, because that's where the most people are congregating, is making sure that that the bigger stores do have a process in place. And I just want to urge the staff to continue, or our staff and also the City of Hollister enforcement folks and the City of Hollister in general, I just want to really urge the city to take that seriously and to make sure we have a continual presence, reminding these large stores about this, whether it's people walking through the stores without masks, or not holding the capacity. I know that the capacity numbers went up, so that maybe that's not as relevant anymore, but mainly just making sure that the stores aren't allowing people in without masks. That's my biggest concern. Thank you.
Thank you. Mr. Espinosa?
Thank you, Mr. Chair. We'll move on to the next item. We have Dulce Alonso, our management analyst. Again, like I mentioned earlier, she's been working diligently with our ad hoc and staff on round 2. So today what we're going to do is give you a brief update on round 2, where we're at, and what's actually transpired over the last few weeks. A lot of work's gone into this program, so I want to thank again staff.
When you're speaking of round 2, you're speaking of the grant funding?
Excuse me, the grant funding.
And
that's
our ad
correct.
hoc committee is still consist of Supervisor Kosmicki and Supervisor Tiffany, correct?
That is correct,
Okay.
and if they'd like to comment prior to the presentation, it's up
Yeah, I
to
just
them.
wanted to make sure that's...
Yeah. Go ahead, Dulce.
Sorry, Dulce.
Yeah, thank you both supervisors for being a great part of this and getting it together. But really the purpose is to get businesses that have been impacted by COVID-19 immediate financial assistance. The overview, the board did approve $750,000 in one-time funds. The grant will range from $5,000 to $15,000. It has to be, to qualify, businesses have to be located within San Benito County and have closed or significantly had to modify their operations due to the California stay-at-home order. So criteria, closed or significantly modified. This means changing business operation to take out curbside and include outside modification. Another criteria is they currently must comply with the local and state industry guidance, as well as our local ordinance. And we just have to verify that there has been some sort of loss due to COVID-19. So closed or significantly modified, these are some of the sectors that fit into closed or significantly modified. It's not limited to solely these, but these are the ones that the state has addressed to close or modify operations. So these types of businesses would be prioritized. So it includes hair salons, barber shops, nail salons, and so on, tattoo parlors, bar, tasting rooms, wineries. And then for operations significantly modified, these would include restaurants that have modified operations for takeout, gyms and fitnesses, dance studios, and other sectors along those lines. So the eligibility, the applicant must operate within San Benito County. They have to be up to date on all taxes. We are using taxpayer money, so they have to be up to date and in good standing. They must also have a current business license and have been in operations for at least a year from February 1st, 2020. We are asking for either 2019 or 2020 tax returns, profit and loss statement for both 2019 and 2020, and gross revenues from 2019 would require at a minimum to be $10,000 and maximum to be 1.5 mil. There's a W-9 that would be required submission as well, and if it is a chain, it must be locally owned to be eligible. We are eliminating, if an owner owns multiple businesses, entities, franchise locations, we're limiting it to only one of the businesses could apply, and we recommend using the one with the highest revenue. So when you submit the application, there's going to be 6 things required with submission. It includes the application, which is signed, W-9, an electronic payment form, a copy of your business license, 2019 or 2020 tax return, and then also profit and loss statements for 2019 and 2020. So I quickly want to share how to access the application or how to get it. So I'm going to share our website, but you can access it through our homepage. So let me stop sharing this. If you don't have access to the internet or can't locate, oops, it's on. So if you go to our homepage, there is a banner on the top that takes you directly to the program. We have the packets available on the top in English and Spanish, so you can click there and download the application. If you don't have access to a printer or can't get it, people can pick it up at administration office at the front desk. Our address is 481 4th Street, and we're located across the street from the courthouse. So let me, oops, go back to, okay. So this round of application, the beginning part asks basic business information, and there's 11 questions. Most are yes or no. With the exception of number 11, it does ask for a brief explanation of how the business has been affected. At the end of the application, the applicant is required to sign. They're pretty much declaring that all the information that they have provided is true and correct to their best of the knowledge. For more information on business licenses, you would obtain it wherever your business is operating. So if you're within the city of Hollister, the contact information is listed here. San Benito County, in the unincorporated area, you would contact us, or you could email HDL, sanbenito@hdlgov.com, and then the information for the city of San Juan is listed here as well. Supporting documents. So we're asking for 2019 or 2020 tax returns. We understand that some businesses may not have their 2020 tax returns yet, so either or would work. A profit and loss statement for 2019 and 2020. One of the questions asked for that information, so this is used as a verification on that question. I believe it's number 11. Important deadline. So it's currently open. We're closing the application submission February 21st. It's a Sunday at 11 p.m. Beginning March 8th through 12th, we'll begin notifying business of how much they'll get awarded, and we're targeting getting businesses their money by March 29th through April 2nd of 2020. So I just want to highlight some outreach efforts that have been made. We've partnered with the tax collector's office and have managed to send out mailers to businesses, and these are businesses that have business licenses within the city, county, and both cities, so City of Hollister and City of San Juan Bautista. We've put out social media posts promoting the grant. We also have a really strong partnership with both cities, and they're pushing out the information as well. We are working with the Chambers, EDC, San Juan Committee, and Hollister Downtown Association, and it provided them the information as well. So that's it on our program. If a business does not qualify for our program, I just want to highlight that our program is a grant, so there's no need to pay back the money. There are other options available if a business is looking for possibly a loan, and I just want to highlight Access Plus Capital, specifically the Grow San Benito, where a business is able to get a microloan from $5,000 to $25,000, and that is it.
Any questions? We'll start with Supervisor Tiffany.
Let me make a couple comments, and I do have a question for Dulce. First of all, when Supervisor Kosmicki and I joined together with county staff to put together this program, I think a couple of things were absolutely critical in our minds. One was we wanted to ensure that the application process was as simple as possible. Round one, I think, was, from what I gather, in some cases was overly complicated, and we wanted to simplify it. Number two, we wanted, as Dulce mentioned, to really focus on those businesses that were most greatly impacted by the COVID guidelines, whether it be during the shelter in place, closing down businesses, or significantly modifying their business, whether it be in the past or currently. And so this grant program is really focused on probably a smaller number of businesses in our community, and that's where we want the focus to be. And then just emphasize that, part of the eligibility is that the business be in full compliance, now and going forward, to be eligible for the grant program. So those are my comments. I'm just curious to also say, I know it's very early on, how many applications have we gotten in so far?
So as of yesterday morning, we had 11. I don't know what has came in today. I haven't rechecked. But we will, so 11 as of yesterday.
Okay, well, thank you. And just want to emphasize what a great job that Dulce and other county staff people have done to help put this together so quickly. So thank you for all your assistance.
Thank you. And I just want to share, our PIO mentioned, or just let me know that through social media, there has been 12,950 views on the business grant, which is a lot for us. So.
Wow. Supervisor Gonzalez?
I'm just so glad that we are doing this second round, because I know that the first round, I was part of the review committee that looked at the applications, and there were so many more that needed services and assistance that we couldn't help. And so it's phenomenal that you guys are addressing this, and that there will be other businesses in the community that will benefit from this. And so I commend you. Thank you very much. Thank you.
Mr. Espinosa?
Thank you, Mr. Chair. Yeah, I just wanted to quickly highlight as well, one of the items that your board actually approved was allocating some of that funding out of that $1 million. It was $750, but we allocated some funding to bring somebody in to actually help us run with this because of the staffing levels that we have, as well as timing. That was kind of really important, that the ad hoc committee was really keen to try to get the money into these businesses' hands immediately, and was really important. With that being said, administration staff just took it upon ourselves to just move forward, because it was going to take some time to go through this whole process. I tell you, we did it within record-setting time, and within 3 weeks, when the program has been rolled out. And we use the first one as kind of a benchmark, as kind of a foundational piece and moving forward. But there were a lot of edits, there was a lot of changes, and there was a lot of fine-tuning that actually occurred. So I wanted to thank everybody, the ad hoc and staff, for really doing a phenomenal job on moving this forward. That's all.
Supervisor Kosmicki?
Thank you, Mr. Chair. Once again, just want to thank staff. Really, the commitment level extraordinarily high, and I just have to say there's a passion level on our staff that you also don't see from the outside, when it really shows when you're working, in these meetings, and I just really appreciate that. Just a few things real quick, just also to emphasize, I echo what Supervisor Tiffany said about the simplicity. We also wanted to make sure that, so there's going to be a review committee that looks over the applications. Another emphasis was to simplify the application so much so that, and to simplify the criteria of receiving the grants, so much so that we take out as much discretion as possible from the review committee, because we don't want to have a situation where businesses are, accusing us of, favoritism or anything like that. That was really important in the process. We had these workshops last week, and a question came up as far as, can we be moved to the front of the line if we didn't get an application last week or last year? And my answer to that was, there is no line. There is no line in this application process. If you are eligible for the grants according to very clear criteria, you are going to win an award for a grant. And I want to emphasize that to maybe some businesses out there that might be hesitant to take the time to go through this process. The money is there. You just have to go through a fairly simple application, I think, to get to that point. And then, so I encourage everyone to apply. And I just want to emphasize again that, we went through this whole enforcement issue, and I know there were a lot of emotions on both sides of that issue. And for me, one of the absolute necessities of going down that road was having some relief on the other side of it. So again, just want to encourage businesses to apply, and good luck. Thank you.
Thank you, Dulce. I think that's all that's all the items we have for round 2 small business grant. So the last.
Excuse me, can I make one more comment? I know it came up earlier, but I just want to emphasize that there's also the Great Plates program that's going forward. Are you going to touch on that?
That's what we're going to touch on.
Oh, sorry. I beat you to the punch. Okay, sorry.
You can see how eager our ad hoc is. They've been a part of most of these things, so thank you for that. Yeah, so I was going to introduce the Great Plates program as our last item of discussion within the COVID item, and that is going to be presented by Michelle. She's from the Chamber. Michelle Leonard. And I want to thank her for all the work she's done as well. She's done a tremendous amount of work on this, as well as staff. A lot of input from OES department and a lot of other employees as well have been working on this, so thank you all. So,
and I just want to highlight, we did receive notice that the program was extended another month, and we got that notice this Sunday. So Michelle worked really hard on working with the businesses to keep it.
What is the new end date?
Thank you.
Sorry to
I don't
catch
have
you
it
off
all.
guard.
Michelle, do you have the end date of this extension?
Early March?
Yeah, it's, I think, one more month.
Okay.
Hi.
There we go.
Hi, everybody. Thanks for having us. I'm Michelle Leonard, President and CEO of the San Benito County Chamber of Commerce, and I have Ashlyn Archibald. She's helping as program coordinator for Great Plates. It's a team effort. We have our Director of Tourism and Hospitality, our Operations Manager, and a volunteer, Savannah, that's been helping. So we're really grateful to be able to share this presentation with you. The Chamber is really happy and honored to be part of a program that helps so many. We'll just go over some general background information, and then we'll go through this really cool presentation that Ashlyn made. And then if you guys have any questions, just please let us know whatever your questions are. So a little bit of background is the Great Plates Delivered program. It's a program in partnership with FEMA, California Emergency Office of Emergency Services through the state of California, and then in partnership with San Benito County. So the Chamber, the county, auditing, the state, and FEMA are all major components of making sure we have this program in San Benito County. So right now we have 486 seniors, 12 restaurants that we're serving, and this helps 105 local employees. So it's really cool. If you have any questions, just ask us to slow down, but we are going to go through the presentation and then just stop us if you have any questions.
Okay, so for the agenda that I had shared this with all the restaurants a few days ago. So it was regarding the expectations, the delivery procedures, the new system in place, the invoice procedures, and then deadlines for the restaurants. So the community impact, as Michelle mentioned, we are serving 486 seniors in the community currently. On average, it's about 7,000 meals a week that we deliver. Every person receives about 2 to 3 meals at least 3 days a week. We do have 12 restaurants participating. It goes for Hollister, Aromas, Tres Pinos, and San Juan Bautista. Over 100 people are currently employed right now due to this program. And no restaurants applied through the state are on a waiting list, but there are about 40 people on the wait list that will be distributed to restaurants hopefully within this week or next week. So these are the restaurants that are involved in this program. This is 4th Street Eatery, Be True Cafe, Aromas Grill, La Catrina's, Payne's, and The Inn. The other 6 are Mission Cafe, Flapjacks, Eva Mays Cafe, Farmhouse Cafe, Manja's, and Grillin' and Chillin'. So in order for restaurants to register, they just go online to the Great Plates website, and there's one of the very top options to apply as a restaurant for the county. I check it about every week, or about twice a week. So they apply to the county, need to provide a delivery service for at least 5 days a week, and then they just need to be able to sign the county contract and agreement. And then for seniors to apply, it's on the same exact website, just greatplates.com. And it has a little bit more to it, so they can either call in or they can email. And currently we're putting everyone on a wait list until we're ready to distribute the participants and get them all a restaurant. But the requirements are that they be 85 or older, or that they be 60 to 64, but they have been diagnosed or exposed to COVID or are considered high risk to COVID per the CDC. They live by themselves or with one of their program eligible adults, are not currently receiving assistance from any other state or federal nutrition assistance programs, have difficulty accessing food or preparing their own meals, and that they earn 600% or less of the federal poverty limit and live within a county or city participating in the program. So these are all required by the state. So the meal expectations for the restaurants, the first one is quality. Because they are paid a fair amount that the state gives them, we expect that all meals are are restaurant quality meals. The second one is the quantity. So there is a minimum requirement for the quantities, but it should be able to fulfill an entire plate for breakfast, lunch, and dinner. And the third one is a balanced meal. And in the following, we'll actually have a list of all the meal components, which is going to be a dairy, grain, fresh fruit and vegetables, and the protein. These were digitally and physically delivered to all the restaurants that are in the program so that we're all on the same page as to what every meal should have. In regards to the meal delivery, every single package needs to be sealed, and then the state gave us what is allowed in addition. So it's boxes with lids, the bio 1 and 3, pint delis, and 2-ounce sauce on the sides with lids. So all fruit must be in a cup with a lid on it, and biodegradable and recyclable packaging is strongly encouraged since we are delivering about 7,000 packages every week. Also with meal delivery, so food safety and handling, the first part on top here, gloves must be worn at a distance of 6 feet is required. So we require that all the packaging has some type of a label on it. That way they know where their food is coming from, they have contact to that restaurant, and that there's reheating instructions. So labels, all the restaurants have to have it on their packaging, and then all of it is packaged and sealed before delivery. Also, with meal delivery, the first one is also food safety. If meals are to be left at a doorstep, and this is per the request of a participant, they cannot be exposed to the sun or rain. Also, for food safety, meal containers are not allowed to be left on a doorstep, nor should the bag be opened. So the only time we will actually leave a package on the doorstep is if the participant asks for it or requests that it do be left there, whether it's that they're exposed to COVID or it's way too early in the morning for them. So that's the only time of day that they'll have meals on the doorsteps. Other than that, it's handed to them. In a timely manner, meat, dairy, or seafood meals must remain at a temperature that is safe for consumption. Delivery times. So breakfast and lunch is to be delivered between 8 a.m. and 10 a.m. Breakfast, lunch, and dinner, all three meals, will be delivered from 8 a.m. to 10 a.m. And then lunch and dinner is to be 10 a.m. to noon. I believe I'm there at 3 o'clock. But in the meeting we shared with the restaurants, and then in an email we've also delivered to them, it's lunch and dinner is to be delivered from 10 a.m. until noon. So with the new system that we had, previously people were able to choose having, for example, on Monday and Tuesday they wanted breakfast, on Wednesday they wanted lunch, and on Friday they wanted dinner. So invoicing, it was very complicated for us to match all these numbers accordingly. So we decided to do a new system. Basically, the people choose 3 days, 5 days, or 7 days. And then from there, they can choose if they want the 3 meals, breakfast, lunch, and dinner, or if they want the 2 meals, lunch and dinner, or breakfast and lunch. So far, we've actually had maybe only 2 people that have only requested just 1 meal. Everybody else is very satisfied with the system, including the restaurants on our end and the participants. Okay, it doesn't show on there for some reason, but on the actual slide that this is supposed to be, we have a meal tracker. And so typically the participants have a list, and to the right of it is a meal tracker, which it keeps track of all the meals that they make and deliver daily. So we can check it, the county that audits, they're allowed to check it. That way we can just keep track to make sure that every person gets a meal and that every restaurant is delivering what their what's on the list. So invoicing, this is the invoice template that we've given all the restaurants to use. So they're all due on Mondays at 8 o'clock. And we have to receive it by Monday. We deliver it to the county by 2 o'clock on Tuesday, so today, in order for them to receive payment at the end of the week. And the price breakdown. So for breakfast, it's $16. For lunch, it's $17, and for dinner, it's $28. Every individual meal delivery fee is $1.66 additional. So on the left side, it says breakfast and lunch, the 2 meals. So that delivery fee will be $3.32 per set of meals that restaurant will deliver. And in the bottom, it's a flat rate of $5 for 3 meals. So for example, 4th Street Eatery, they do 7 days a week, breakfast, lunch, and dinner. For every person that they'll deliver 3 meals to, they'll get an additional $5 delivery fee. So the participant increase from May to January. So during our first week of restarting the program, we had an average of 50 phone calls a day looking to enroll or renew participants. Back in May, I believe the number was about 156. In September, it went all the way up to 306. And then in the first week of restarting the program, January 18th, that first week alone, it went up to 176 participants. And we're still going. I still have many calls a day, people coming in, people emailing me about joining this program. So it's constantly growing. Okay, so as I mentioned, it was 306 was the number that we started from that was left off in September. And then since then, we added 176 participants. So this is the Great Plates team that have been working on this program. So myself, Ashlyn Archibek, our assistant, Renee Sarmento, our other assistant, Savannah Sepulveda, our CEO of the chamber, Michelle Leonard, and then our director of hospitality and tourism, Jennifer Rodriguez. All right, and does anyone have any questions?
Start with Supervisor Kazmicki.
Thank you, Mr. Chair. First off, I just want to thank everyone involved with this really successful endeavor. Thank you to the Chamber for taking this on. It, you know, especially after seeing that presentation, it sure is a lot of work. And, you know, I can't say enough about the Chamber stepping up and taking this on and doing the work that they've done. Just a couple smaller points. I want to say thank you to for getting Aromas Grill on the list. Aromas is oftentimes forgotten, and I, you know, early on when I noticed that, you know, I had some talks with staff, and they were on a waiting list, you know, which I understand there was a waiting list, and we kind of worked that out, but just really thankful that you got Aromas Grill on there to make sure we're serving the Aromas area. San Juan only has one, I believe, restaurant right now. I know that's just an issue of, you know, some of the criteria and just the desire, I guess, in San Juan, but let's just keep our antennas out for if we could potentially add another San Juan, if there are any restaurants, because I know you have to serve breakfast, lunch, and dinner and meet these certain criteria, but if, you know, hopefully we can find another San Juan restaurant at some point. And then the delivery situation, I've had some questions come up about the delivery. You know, there was a restaurant in San Juan in particular that was considering doing this, and they apparently backed out because they couldn't do the delivery part. So I'm just throwing it out there. I'm wondering, is there a way of having a third-party delivery situation, or is that too much? Again, I'm not trying to throw more work at the Chamber here because they're doing a lot already, but that's just an idea. If it's not feasible, I fully understand. And then just want to make sure that we're keeping close watch on quality control, because we did have some questions early on about, you know, I had some residents, and I communicated this with staff, just sort of giving me examples of, you know, one or two of the meals, and it didn't sound great, to put it lightly. As far as what was being offered, and, you know, for $22 a meal, I think we have to make sure that the quality is at a certain standard. So that's all for me. Thank you.
Supervisor Gonzalez.
First of all, I want to say thank you to the Chamber. They are doing a phenomenal job, and they are addressing concerns for quality control and so forth. There's a huge range of people who that I'm familiar with that are participating in this. And so I frequently am calling them, sending them snapshots of the mail, either to commend or complain about the quality. And so they are on it, believe me. And I know it's a huge undertaking that they have, but I do know that the Chamber has met with the restaurants and kind of laid down the lines of, this is the minimum level of quality control that you need to meet. And they're very good about that, very responsive to concerns. So if there's anyone who is a participant on the program and not happy, just make sure you make your concerns, make them aware to the Chamber, because they are very responsive. And again, I commend them on, you know, for what they're doing. I'm glad to see that there is a delivery fee associated with that, because that means then the restaurant that is preparing the meals can then offset their staff with that are out there delivering. My mom was a participant for over the summer, and she was getting some meals from Tres Pinos Inn, and I know that they were short-staffed and getting the delivery from Tres Pinos to the Hollister side. And the poor gentleman in the car, he opened up his truck, and you could see all the bags that he had. And so they, you know, the restaurants were really being taxed with that delivery. So it's a good question that you raise regarding the third party, but I think it might be adding one more element to the delivery process, and it might complicate it more than make it easier. But ladies at the Chamber, thank you very much. Thank you for being so responsive to my phone calls, and just for doing the best that you're doing. Great job. Thank you.
Supervisor Tiffany.
Yeah, once again, I'll just thank the Chamber for doing a great job. I know the first round on Great Plates last year was very successful. I know, you know, Michelle mentioned to me that there were a number of restaurants that said to her that, but for the Great Plates program last year, they may not have survived. So I know this is a really critical program for both the restaurants as well as for senior citizens. It's a real win-win situation. And it's going even better this year, and I think that's largely because of the chamber's involvement. I know, we're talking about delivery. I know that was a limiting factor last year, and it was a part of the difficulty with logistics. And it's great that I think for the most part that issue has been resolved with how the chamber is approaching this. I did have one question. With more and more people getting added, and I'm certainly glad that this got extended another 30 days at least. Are there more restaurants that are going to be added? Are there more restaurants that are trying to get added to this program? I'm just curious about where that stands. Thank you.
Supervisor Hernandez?
No question, Mr.
Okay, I just, two quick questions or two quick comments here. First one is dealing with the restaurants. I want to thank the restaurants for stepping up and serving these meals. I know 3 meals a day, breakfast, lunch, and dinner, and delivering. It's a task on the restaurant, too. The chamber, of course, they took this on, and correct me if I'm wrong, Dulce, it was to help us out because we were inundated through the OES and through yourself. You guys are running the program. Is that safe to say?
Yeah, OES was running it before. We had a partnership with COG, but for delivery, and they opened up and started transportation. So we lost the transportation element, and really we appreciate the chamber stepping in and helping the county.
So my question here, and this is something you can talk with the ad hoc committee probably later on, Michelle, is are we covering the cost for the chamber? I mean, I know you have labor, you have a lot of things involved in the day-to-day cost, but are we covering your cost? And if not, what do we do? I mean, it's not that they're an organization that if they had to hire some other people, I just want to make sure we're even, if anything, with the chamber.
Yeah, and just so you're aware, we did discuss this breakdown. I think in the very onset we had a dollar figure to your board that was presented, and that was the cost that they basically looked at what the program was going to be. And we have not followed up with them to make sure they're whole, to answer your question specifically, which we can.
Yeah, I think that might be wise for the ad hoc committee since it is within their realm. I mean, I know I put a lot on you guys, but if you can actually just, talk to them and see, number one, seems like there's additional headcounts, and I just want to make sure that at least we're whole, at a minimum.
Yeah, and we can do that. We can work with the ad hoc on that, not a problem. I did want to add a couple of things to your question, Supervisor Medina. We did lose not only COG, we also had lost an employee in OES, which was instrumental in helping us facilitate this program before, as well as even in our local administration office as well. So we were down a lot of people, and that was one of the reasons why we reached out, and we kind of just try to move forward with this as quickly as possible because we wanted to get the food out there to everybody and really keep the restaurants in business as well, too. Yeah.
Any other questions from any board members?
Again, I was wondering, and this is for the chamber, are there additional restaurants still going to be added? I'm just curious.
We can answer, there was a few questions, so we'll just kind of go through them one by one. In the beginning, Supervisor Kosminski asked if there was any way that we could maybe outsource delivery for the restaurants. And previously, there were a lot of restaurants that had family members volunteering or just community members volunteering. And because there wasn't consistency, it made it really tricky for the restaurant to ensure quality. So when we approached them and we're like, hey, I know this might be really tricky, but if you guys could do your own delivery, it would actually make everything a whole lot smoother. And everybody agreed. They were like, if we know for sure that we're going to deliver all our own meals and have X amount of meals per day, like they would bring on a staff person to be dedicated for that task. So we've addressed that with all 12 restaurants that are currently enrolled. And though it would be nice to have like an outsourcing opportunity for additional restaurants that need that delivery service, the ones that are currently enrolled don't currently need additional delivery support. Because when there was that like those variances in availability for transportation support, that's what really kind of made the program administratively and logistically really tricky. So taking out that variable makes the program a whole lot smoother for everybody involved. But if there's anybody that, let's just say, is the restaurant that wants to participate that doesn't have, like, let's work together one-on-one to try and address that and see how we can meet that need. But like overall, adding in that major component, it's not necessary for all 12 restaurants at this time, but we would love to say, you know, like, hey, how can we help? And let's see who we know. And, you know, if there's any other businesses locally that have transportation, like a taxi or a limo or an Uber driver that's not working, maybe they could fill that need. We haven't had any restaurants that need that yet. So if there are, like, please have them talk to us, because we would love to facilitate getting them what they need so that they can be part of the program. As far as a list of restaurants that are eligible through the state, so you just like apply through the state at the state website, and then the state sends us a list and we can check it. We just checked it this morning, and it'll say, like, there's a specific restaurant that's interested and this is what they're capable of doing as far as like a number of meals, and if they meet the criteria, either being able to do breakfast and lunch or lunch and dinner up to 7 days a week, like Ashlyn showed that either 3 or 5 or 7, if they can do meals and meet those criteria and do their delivery and have a menu that's a varietal menu that changes for the whole month, then they would be eligible to be in the program. The requirements through the state are not super specific, just that they can meet the meal expectations and the variety, because that's a big part of the nutritional part of the program. So if there's anybody that's interested and doesn't know if they might qualify, like, they could totally call us, and then we can just kind of walk them through the application online. But right now, there are not any restaurants that have applied that are not already participating and have a roster. So all 12 people that are operating apply through the state, and they're good to go. We have reached out to a couple other restaurants that we think could meet the menu requirements, doing breakfast, lunch, and dinner. Some of them have been located in the city of Hollister, and the ones we've reached out to saying, like, hey, we think you'd be a really good fit for this program, they just can't do it. They don't have the capacity. They're not able to front the costs for meals to get started. You know, just, I think because COVID's been kind of tricky, a lot of people aren't willing to take that extra risk right now. So I think if there were more ways we can help them, I think there might be more people interested. But I think because the specifications of kind of needs of the varietal menu are kind of where it limits a lot of people. As far as the cost of the chamber and the contract that we have with the county for being the local administrator of the program, as we can all see, it's a super involved program. There's a lot of seniors, there's a lot of restaurants. We work with the county to ensure auditing and invoicing is correct. We work with the restaurants to make sure that they're compliant, and if they have any questions or if we have roster changes, we communicate with all the restaurants super often. And the seniors, whether they like their meal was late, their meal was cold, they didn't like it, they wanted a dessert, like, they're gonna tell us about it. So we get a lot of calls today of seniors that are super appreciative and super grateful, and they really just need a friend. So administratively, it takes a lot of time, but more than that, it just takes a whole lot of heart. And for us, I think for us, that's why we're so passionate about this program, because we know that we want this program to succeed for multiple reasons. But if there's anybody that has some time and wants to be like part of this program, not so much as a restaurant or a delivery driver, but like calling these people who could maybe use a friend, or writing some cards or some letters to these seniors I think that would be really cool. Like if anybody like knows a group of students or adults that, you know, want to take on an extra task, I think that would be a really cool component to this program. That would take it to the next level of us saying, like, we understand there's a need for nutrition, we're filling in the gap, but I think because of COVID, there's still a big emotional need for these seniors, and we're not meeting that need. So I think if there's any help that we could ask for from our community, whether it's the Board of Supervisors, anybody, our local nonprofits or community members that have time, that would be our only ask. It's not so much about money, it's just anybody that's willing to invest time and love for these seniors, that would help us a great deal. And that would actually take some of the administrative time off of us so that we can focus on the logistics, administration, and financing part of this program. So it may sound crazy, but I think that's all we would ever truly ask for and need to just make this program continues successfully.
Thank you, Michelle.
I hope that ends. Yeah, sure.
I just wanted to add one more thing with regards to cost. I know we've presented this before. FEMA picks up 75% of the overall cost, and that's what we're looking for. Looks like they extended it to March 8, 2021. State picks up 18.75%, and the local county picks up 6.25% of the overall cost. Just wanted to make sure that your board was, understood that. In the last go around, when we went through this process, we came very close to spending about $800,000 overall. I think it's a huge investment this year. Now that the time has been very short, condensed since we started the program, but we've almost doubled the size of the program. So that number is going to be obviously higher, but I think it's a really big benefit for the local community from an economic point of view, as well as from assisting our elderly as well. So
The 6.25, the county?
That's correct.
Can we use CARES dollars for that?
Yeah, and so that's what we did the last go around. Obviously, the feds, there was a requirement, and at the end of the year was when we had to expand all of our CARES funding, the CRF funding. But they did since extend that to the end of this year. We actually allocated some of our excess. We got a presentation from our budget officer that would actually cover some of our safety costs, which was allowable expenditure.
Yes.
So we weren't sure at that time. So there is some funding there that we could glean from to infuse it back into that 6.25. So just so you know, and we're also going out to get reimbursed for the $600 or about $700,000, $800,000 from before, and then we would reinfuse that possibly back into this program. So I just wanted to make sure the board understood the fiscal side of things as well.
So just for clarification, that 800,000 you're talking about, the hope is that's going to get backfilled.
It will be backfilled.
With FEMA, it's primarily
State
FEMA?
and FEMA, yeah.
So can I ask one other question?
CRF, just to be clear. Yeah.
Be for you as well as maybe for Michelle. So I know that this got extended till March, but it was literally in the last hours that it got extended, which seems kind of nuts, but I guess that's the way it's working with the state and with FEMA.
Yeah.
Is there anything? Is this the way it's going to work at every month? And what if, I hate to drop the program because it is so successful. So I'm just curious about that, when this comes around again late in March.
It's a really good question, Supervisor Tiffany. I received an email this weekend, the feds they haven't actually, continued the program. So this is what happened last time. We actually went through this and we just didn't get any word. I think they finally approved it like 3 or 4 days after the deadline. And what happened is the businesses just said, look, we're reopened, we're busy, we don't really have the manpower to continue with this program. There were some issues on delivering the product to the elderly. So at that point, there was just kind of a lot going on. We really didn't have an interest. And then all of a sudden, things closed down again. So there's a keen interest in moving forward again from the businesses. I think with that is my thought process over the weekend was let's continue it because Most likely, the feds are going to approve it 2 or 3 days later. And then I got the email right after I was getting ready to hit the send button to continue it. They finally did approve and continue it. So I think that's what we're going to do, just to keep everyone moving forward. If we don't hear anything within 3 to 5 days, then we'll probably have to stop the program. But I would rather just keep the ball rolling, because if we stop it, it's really hard for the businesses, it's hard for the elderly. So I think it's a good question to bring up here as a talking point with all of you. I think staff's just going to continue this, and then if we finally get word that they end the program, then we'll have to end it.
Yeah, I think that's a good approach. I was hoping that's what we were going to do, but like you say, we got the notice at the last minute, which is great. Yeah. Okay.
Or after the fact.
Yeah. Thank you.
Yeah.
Mr. Chair, one quick question. Do we know our net cost, assuming we get reimbursed, that 6.25% from maybe last round as an example?
Yeah, so we are actually getting reimbursed the entire 6.25%. So normally, we're not allowed to use FEMA federal money to cover our cost in normal conditions. So like in this case, you have FEMA, you have state, and you have local. The local has to come from usually a different pot of money, normally. This is very unique with COVID. What they decided to do is allow the CRF funding to be used or leveraged from the local entity as local money, which is unheard of. So it's basically federal money here and federal money here. So that's usually, it's normally not the case. So I guess to answer your questions, we're going to be fully reimbursed for the last go around. This one, though, we might have a very small cost. It really depends. But I think it's worth it to move that forward.
Okay.
Yeah.
Any other questions, anyone?
Just a kind of comment that I see this program as being a great ambassadorship for the eateries, the local eateries, because, right now while we're closed down, people aren't really leaving their homes, only for necessities. But once this community is open to freely move about the county, freely move about the state and the country, these seniors that have had a taste of these plates from, restaurants that they may or may not have frequented, in the past, it just builds a relationship. And so I don't know exactly the procedure that the chamber is using, but I know that they have switched providers so that the recipients aren't just getting it from one restaurant. There's been a switch, and so there's exposure to individuals who may or not have frequently these eateries, and now they have a taste of these meals that they may wish to establish a relationship in the future. So I'm happy, very happy with the progress that this whole Great Plates program has taken.
Okay.
That's everything, Mr. Chair.
I will now open it up to public comment.
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. We have no speakers via, there you go. Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, and I got to be quick. I only have 3 minutes. So I really like the idea of doing third-party delivery. Thank you, Colin, for bringing that up. Supervisor Kosmicki, I'm sorry. I do know of one participant restaurant that was actually approved and went through the whole process, but they don't have the capacity to do delivery. So I would like to work with them with regards to that. The Meals on Wheels program is only Monday through Friday, and I don't know if there's a way to waive that, because I know it's by state mandate, but they only get 1 meal a day. Is there any possibility to add this to them? I know it would have to be some kind of a waiver. Let's see. Okay. Gosh, we've gone over so much. Okay, so I'm going to focus back on the San Benito Health Foundation. It's not about demonizing the foundation. It's about holding them accountable. It's not about the public health department being a good partner. It's about the San Benito County. It's about the San Benito Health Foundation being a good partner. It's not about the Board of Supervisors apologizing, and I was really thrown back by that comment. It's about the San Benito Health Foundation apologizing for not following protocol. It's not about them being able to call within 30 minutes because the vaccination is going to quote what they call them orphan. There was a list. There was a list made by Rotary members of San Juan Bautista, and they called their friends and they called their families and they put them in a list. This had nothing to do with anything to do with vaccinations that were going to go to waste. For them blaming the county that there were 400 vaccinations that were going to go to waste is completely untrue, and no one called them out on that. I want to remind the public that the Board of Supervisors is not responsible for closing down businesses. We, the public, are responsible for not going and based on our lack of following protocols regarding the CDC, large gatherings. That's why these things are happening. A reminder that the numbers are going down, but that does not mean that we need to loosen up on our CDC protocols. I appreciate the passion by Supervisor Kosmicki with regards to saying that we forgot the farm workers and the farm workers out there. As a Latina and as a former farm worker, I know what it takes to go out there and work hard and go home and tired. And there's no communication with them. They're not all social media savvy. There's got to be the way to go out, do some outreach on them. And let's not forget that we shouldn't dismiss.
Thank you, Elia.
We have no more speakers via Zoom at this time.
Okay, we'll bring it back to the board. There was no decision-making whatsoever on this?
If any of the board members wanted to request that anything be scheduled at a future board meeting, number 4 would be the time that they would have to request that. Item 4.
COVID?
Yes.
Okay.
It says discuss any additional members desired by the board to be scheduled at a future board meeting and provide staff direction.
Board members, anything that needs to be on the agenda for the next meeting on the 23rd, COVID related specifically?
Were you going to request an item regarding the no, the hazard pay?
Oh, I'm sorry. As I said, I have had so many meetings. I feel like I was inefficient in giving my my staff report in terms of the things that I've conducted. But I did receive an email regarding hazard pay, and both Supervisor and Medina, I received it. We didn't chat per se, but we exchanged an email, and so I guess it's something that we need to address. Santa Clara County, the city of San Jose passed an ordinance that is awarding hazard pay to the essential workers. And my concern was, is that something that we as a county would be interested in looking at? And so without going into it any further, it may be can it be a future agenda item to look at it and see the feasibility of it? It would not affect county workers per se, but it's more global to the general population. It would impact financially, fiscally, private employers, and so that's a concern that I have. But it is an email that was sent to me by a member, one of my constituents, and so putting it out there, it's a $5 per hour hazard pay. And if we can look into that and see if it's even something that the board is interested in.
I would suggest having that as part of the ad hoc committee, have them actually look into that and then maybe come back with a report, if that's okay with this board.
Just so I understand, that's because wouldn't hazard pay be up to if it's for a private employer, it would be up to them. I'm not clear on what.
I'll send you the article.
Okay.
Yeah,
How about
we
that?
can.
That way we don't.
Sure. If we can get that to all of us, and then we'll look at that.
We can
Yeah.
take a
I'll
look
forward
at it.
the article.
Okay.
Good, thank you.
Yeah.
Thank you.
Anything else? Anyone? Supervisor Hernandez, anything?
Nothing, Mr. Chair.
Okay, well, we'll bring it back to the board, and we will,
We can break for a closed session. We have lunch, and then if that's okay with the board, so we can continue on and then come back.
at this point in time, we'll break for closed session. Legal counsel?
Number 32, closed session, conference with legal counsel, existing litigation, subdivisions A and D1 of 54956.9, number of cases 6. Anu Yan versus Paul Burns et al., including the County of San Benito County Superior Court, County of San Francisco, case number CGC 17-562-114. 2, Thomas Jefferson Cares versus County of San Benito, U.S. District Court, Northern District of California, case number CV 18-7651, YGR. Barragan, number 3, Barragan versus County of San Benito, California Superior Court, County of San Benito, case number CU 20-00121. 4, Barragan versus County of San Benito, County Superior Court of California, County of San Benito, case number CU 20-00165. Gabriel Escobedo versus County of San Benito, Superior Court of California, County of San Benito, case number CU-17-00067. 6th District Court of Appeal cases H047882. And Cedar Point Nursery versus Victoria Hassad et al., Supreme Court of the United States, case number 20-10, regarding an amicus brief. Number 33, closed session, conference with legal counsel, anticipated litigation, significant exposure to litigation, number of case 1, pursuant to Government Code Section 54956.9D3. And 34, anticipated litigation, closed session, conference with legal counsel, significant exposure to litigation, number of cases 1, Government Code 54956.9D4. And lastly, number 35, conference with legal counsel, anticipated litigation, significant exposure to litigation pursuant to 54956.9D2 and E2. The number of cases 1 is potential additional litigation related to issues raised by Disability Rights Coalition concerning 5150 holds.
Is there any public comment on the closed session items?
Members of the public who wish to speak on these items, please press star 9 or the raise your hand icon. We have no speakers at this time.
Seeing none, we'll bring it back to the board and we will adjourn until 1:49.
Okay, so 1 hour.
Boardable action except on item number 32, the two Berrigan matters which were listed as number 3 and 4. To avoid further litigation, the board authorized settlement in these two litigation matters and authorized the execution of the settlement agreement after it's finalized, the terms and conditions of which will become final after finalization, and that's by a 5-0 vote. And also on item number 35, which was the potential litigation under Disability Rights Coalition, the board also authorized settlement, to accept settlement after finalization of the language, and that's also a 5-0 vote, and that the terms and conditions of which will also become public after that's been finalized.
With that being said, we will resume our number 31 off the regular agenda. We'll go to the Resource Management Agency, Mr. Benny Young.
Thank you, Mr. Chair, members of the board, Mr. Espinosa. This is just an informational item, and we won't take long, but we thought you might be interested in knowing a little bit of the background on habitat conservation planning efforts in San Benito County, spanning over the last couple decades. We have a significant opportunity, we believe, to apply for a grant through the U.S. Fish and Wildlife Service that will allow us to perhaps complete a habitat conservation plan for San Benito. It's one of the deliverables remaining under the general plan. And all we wanted to do today was give you a little bit of background on the HCP program here, our efforts to get it accomplished, and indicate that we would like to come back to you on the 23rd with an actual grant application approval that we could then submit. So it's just background information to set the stage for returning on the 23rd for an actual action item. And Ariel Goodspeed from our planning division is here to make the presentation. Ariel?
Hi, good afternoon all. I'm excited to be here and to just inform you of our current San Benito County Habitat Conservation Plan Preliminary Study Area Ordinance 541 and our General Plan Policy NCRA. So the Ordinance 541 was actually adopted by the Board of Supervisors back in 1988 to establish a habitat conservation plan study area and setting an interim mitigation fees to finance a habitat conservation plan and protect the San Joaquin kit fox. So since 1988, the county has been collecting fees from development projects, and we have a fund account to put together a habitat conservation plan. Also, in our 2035 general plan, there was an implementation program, Habitat Conservation Plan, that the county shall consider working with the state and federal agencies to prepare and adopt a habitat conservation plan for all listed and candidate species in San Benito County. So just a little bit of information on basically the benefits of a regional plan such as the Habitat Conservation Plan is that it would better serve the community than project by project permitting. It helps streamline permitting approach. It helps approve plan faster permitting mechanisms and provides clarity and transparency. So this is kind of just a rough diagram of what the streamlined permitting process would look like. We would get in a new project proposal. The local government review consistency with the habitat conservation plan. The proponents would then pay fees or provide mitigation, and then the project would go under construction and natural lands would be conserved. So just some additional benefits for regional conservation plans. In addition to streamlining projects, it increased local control, it's improved mitigation, creates new open space, new recreation space, it protects viewsheds, watersheds, prevents new species listing, and protects against climate change. Oh, thank you. Appreciate that, Dulce. It also attracts new money for conservation, provides necessary agency permit And it also opens actually the door for additional federal grant money under the HCP Land Acquisition Program. So it basically creates a door for landowners to, preserve and protect, critical land. It's not required for landowners to do it. It just is another door that gets opened when we do have a habitat conservation plan in place. So on the 23rd, staff will be bringing for future action a federal grant application for a countywide habitat conservation plan and natural community conservation plan called the San Benito County Conservation Plan. So when we bring it back on the 23rd, we'll go through all the components of our grant application. We are allowed to apply for up to $1 million of federal money. We will be just under about $970,000, and then there is a contribution component that the county is required to do. However, we have the funds to do it. We have an account with fees that we've been collecting since 1988.
Whoa.
That can go towards our contribution requirement.
What is our contribution, just roughly?
We're required to do a minimum of 25%. We are considering doing 26% because that would basically, it is a competitive grant, and so there's different components of that grant to make it, make our application more competitive. So we're going to shoot for a 26.
Thank you.
I do also have, from U.S. Fish and Wildlife, I have Mark Ogłowski and Rachel Henry on the line if you have any technical questions, but this is going to be coming back on the 23rd.
Just a quick question. How common are these habitat conservation plans? And maybe that's a question for USFS.
I can open it up for U.S. Fish and Wildlife. They are common, and actually are required from the Endangered Species Act. Mark, are you on the line?
I know Benny could probably answer that also. I mean, they're all over the county.
Mr. Chair, this will just be kind of a qualitative answer, but I do think they're fairly common, and I think it's a good tool to help manage growth in a way that supports the environment, and it allows us to do things like mitigation banking and identifying certain areas that need to be set aside. It creates predictability for the development community and a more structured way to deal with mitigation associated with habitat issues in connection with individual projects, rather than having to do that every time you have a project.
So it looks at it broadly as our whole county, because species don't necessarily just stay on that one property that development's being on. So it looks at it as a regional base.
Mr. Chair, I apologize, I didn't ask Mr. Chair before, but so would it reduce the need for a full EIR? You know, it talked about streamline planning. What is meant by streamlined planning?
So, so when a project comes in, as part of an initial study, biology is on there as one of the items that have to be done. And a lot of times you're having developers have to go out and do a biology study, come up with, and then through that, there's, based on what's there or around the area, you come up with mitigation. This will, a developer will know going in what the mitigation would be required or what fees would be required, not 3/4 of the way through the process.
Okay. Thank you.
Answer your question?
Yep, thank you.
Proceed. Thank you.
Anything else?
Any questions from anyone?
Thank you, Mr. Chair. We're not requesting any action today. I appreciate the time.
Well, hold on one second. Supervisor Hernandez, any questions?
No questions, Mr. Chair.
Okay, thank you.
Public.
Vanessa?
Yeah, no, it was just the public. It was just, no, no input, I was just curious. I'm just for the public to comment on it. That was it. Yeah, I know you're right.
Any public comment?
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for calling my name. I just have one question that you want to, who's going to be supervising? Because I know you want to be able to go forward, but who's supervising, and then who does it go to? Does it go to a committee? Are you going to create a committee so that there's transparency on what decisions are being made? Thank you.
This will have a public process. Right now, we'll be applying for the grant, but there'll be a public process in developing the plan.
And thank you, County Council. And not only that, but it's developing a plan, so it'll include addressing the kind of questions that the citizen just asked. What's the process? And there will be public involvement in developing the process as well.
Okay.
As part of the grant application, there is a large stakeholder outreach component that's required under that grant that we would be doing. So the public would be very involved.
Thank you. Any additional public comment?
We have no more speakers at this time.
Seeing none, we'll bring it back to the board. This was for informational only. We will see you back on the 23rd. Is that right?
That's right.
Right on. Okay, now we're going to head over to the consent agenda. The numbers that were pulled, we'll start off with number 9. I believe Mr. Hernandez pulled the number 9, create an ad hoc committee and appoint Supervisor Bob Tiffany and Supervisor Colin Kaminsky for the vaccine.
Yes, thank you, Mr. Chair. I'll just keep it brief. I mentioned my comments earlier, and I believe that I have a desire and interest to represent. I don't imagine it would change your mind, but still, I just wanted you to go on the record to mention that I wanted to be directly involved in representing, I believe the opportunity of the Latino community for this vaccine distribution process.
Okay, any other board members have any questions? Seeing none, any public comment?
Members of the public who wish to speak, please press star 9 or the raise your hand icon. Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for calling my name. I believe that the choices as for Supervisor Tiffany and Supervisor Kosmiski are great choices. They are very involved in the community. They have a lot of outreach in the community. And honestly, Supervisor Hernandez, I don't know where you've been. All of a sudden now you're Latino. I do not appreciate you throwing out the race card, saying that you want to be placed on this agenda because you represent the Latino community best. And that is just absolutely not true. You couldn't do any more of a better job than either of those two supervisors. Thank you.
Thank you, ma'am. Any other public comment?
We have no more speakers for that.
Bring it back to the board. What's the wish of the board?
I move to approve the ad hoc committee to appoint Supervisor Bob Tiffany and Supervisor Colin Kaminsky for the vaccine.
Do we have a second? I will second. What's the, all in favor?
Aye.
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 No.
Okay, motion passes 4-1. Yes, 4-1. Supervisor Hernandez against. Okay, we'll go to number 13, Board of Supervisors. Appoint Supervisor Colin Kaminsky as a delegate and Supervisor Mark Medina as an alternate for the Integrated Waste Management Regional Agency Local Task Force. That was pulled by member of the public. Any questions from the board first? See none, we'll put it down to public comment. Any public comment?
Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for allowing me to pull this item. So as you know, Supervisor Medina and Supervisor Hernandez, I have an issue with recology. And so this is regarding the integrated waste management. And I've always said along that the integrated waste management should have the citizens' best interest. And so far, I have not seen it from them. So I want to bring it to both of your attention. We're starting off with a new year, and the issue is still there. It hasn't gone away. I really would like to hold the integrated waste management accountable. I also probably believe that this has to do with future, what we're going to do in the future with probably something off with John Smith landfill. But more importantly is the accountability of recology and putting you guys on notice that I'm still watching what's going on with recology. So thank you so much.
Thank you for your passion in this, ma'am. Any other public comment?
We have no more speakers.
See none, we'll bring it back to the board. What's the wish of the board?
One quick comment. Just wanted to make note that I know Elia has had concerns about the, I believe, the low-income
Yes.
program, and I just want to let the public know that I have contacted Recology and talked to them about that, and have been assured that they're going to be making further efforts to do more outreach on that low-income program, and they actually agreed to put a notice in their newsletter that went out to every resident, informing people about that program, but it certainly will be something that I'll keep a watch out for. Thank you.
Well, you're definitely a man for the job on that one.
Colin, let me just mention, excuse me, I received a letter and a follow-up email just recently in that same regard, so I'll circle back to you, or I'll forward you the email.
Any other questions? What's the wish of the board?
I'd like to make a motion that we appoint Supervisor Kosmicki as the delegate and Supervisor Medina as the alternate for integrated waste management.
Do we have a second?
Second.
We have a first, we have a second. All in favor?
Aye.
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 5-0, motion passes. We'll go to number 15. Approve resolution acknowledging the Hollister Fire Department to perform the inspection of certain occupancies required annually according to section 13146.2 and 13146.3 of the California Health and Safety Code. Chief Bedolla, thank you for attending, sir, and thank you for waiting for so long.
No, thank you, I appreciate it. Thank you, board and Mr. Chair. Can you guys hear me okay?
Yes, sir.
There also, okay. I'll give you a little update on there, especially for the public. After the tragic 2016 ghost ship fire in Oakland that killed 36 people, Senator Jerry Hill introduced Senate Bill 1205, the Fire Protection Services Compliance Reporting. The bill was passed and it was added to the State Health and Safety Code last year. The California Health and Safety Code was added and became effective September 27th, 2018. The California Health and Safety Code requires all fire departments, including the Hollister Fire Department, that provide fire protection services to perform annual inspections in every building used as a public or private school, hotel, motel, lodging house, apartment house, and certain residential care facilities for compliance with building standards as provided in the Health and Safety Code. It requires that all fire departments, including the Hollister Fire Department, that provide fire protection services to report annually to its administering authority on compliance with the section. So essentially, when the ghost ship fire happened, and I'll let you guys know the background of it, everyone was pointing fingers. The fire department had said, hey, this is a disaster, this is gonna happen, this isn't right. They'd bring it on up to the chief would bring it on up to their board or their council, their supervisor, everyone else. So essentially, everyone was held responsible for it. So it's our job to do them annually and to report back to you. But if we can't report back to you, we have to give you a reason why. So we're basically throwing it on your lap. If we're unable to do the inspections, it's our responsibility to come to you and say, hey, we need the help, we need more personnel, we need to figure out how to get these inspections, so we'll present it to you. So, for instance, if the boards or the councils turn it down for any other reason or something, they're accepting that responsibility on it. So that's it's not really trying to scare, they're just trying to hold someone accountable for this. So everybody's head rolled during this one, right there, from the fire chief, the city manager, to the council and everything like that. So they made it a state law, so that was passed back then. We did do it in 2018, we didn't bring it, but we did finally, we finally got around to it, bring it to you, because we have to bring this to you, and everyone, have to bring it to the city of Hollister, the Board of Supervisors, and San Juan Bautista, that give you the status on what we've inspected. So as of 2019, the city of Hollister, we completed 367 of 369 inspections. We did 26 of 26 in San Juan Bautista, and we did 13 of 14 in the county of San Benito. That was all assemblies, all schools. I've hit every school in the county, all our hotels, motels, apartments. Not only are we doing apartments, but we're also hitting the duplexes too. But it's on from triplexes on up is what's required. Residential adult care facilities, adult child care facilities, group homes, rehabilitation facilities, even the jail and courthouse. The only reason you'll see a number that's kind of off one year, because the jail and courthouse is due every other year. So that's why we missed it on that. That was in 2019. In 2020, we completed 371 of 371 in the city of Hollister. We completed 26 of 26 in the city of San Juan Bautista, and we completed 13 of 13 in the county of San Benito, for a total of 410. So that's 410 inspections that are mandated annually, that we completed last year, and our list is growing. So we have some lists of apartments, but we're trying to get together with the tax assessor or the assessor's office to be able to find. We need to find all the farm labor housing camps, make sure we have updated lists on all the apartments and duplexes, so we can get out there and do it right. The schools, and we'll be adding on to it soon, because we have apartments coming up in Santana Ranch for the county, and then we have another school coming up also. So this list is constantly growing as we're finding more. So our goal is to make sure we find every single one, and then some, to make sure we complete those inspections. So it's been a busy year. It's been a busy year for us. And the good thing about it is we can recover fees on this. We can charge for a fee inspection on this to be able to recover that for our staff. But for the last 2 years, we haven't done that, and we'll put it out there because of COVID. We don't want to hit people when they're down, so we'll wait until we can start to do that to help to offset it by providing the staff that's needed. So that's all I have for you right now for this year, and then we'll be coming back to you next year for the same thing. Oh, here we go, sorry. In addition to that, well, are there any questions on this? I have something else to add.
No, thank you very much. Mr. Tiffany?
One question, when you do an inspection, in how many cases, I'm just curious, in the past, that you've run into an issue, and then I gather you do follow-up with after that inspection?
Okay, so right now we're in the there's a lot of issues actually, because you have to have your serviceable fire extinguishers, your exiting, and some of them, they're, depending on the size of the facility, their sprinklers are out of date and testing. So we're addressing those, and a lot of times the bigger complexes, people will come out, we'd be able to address them right then. Right now, we don't have the staff to follow up on it, but we're in the process, we have to handwrite and mail every one of them out to the property owners, so we're in the process of that right now. So we're giving them the list, we're telling them to comply with it, and then you have any questions, call us back, we'll come out and do the inspections, but we're listing all the violations on there. And a lot of times, the residents are willing to call us in and accept us, because they're like, it turns into a code enforcement issue. So we have abandoned cars, they're like, get rid of these cars. They have trash, get rid of this trash. The landscape's overgrown, they're like, get rid of this. So a lot of it's just educational. Sometimes before you know it, like for instance me, I forgot to check my smoke detectors last year, and you know what, the batteries are dead. So it's done intentional, time flies, and everyone forgets about it. So we take it as an educational approach, and most of the time, actually all the time, people do appreciate it.
Okay, makes me feel better that people from the fire department are forgetting their smoke detectors as well as me.
Well, nobody's perfect, and that's why we treat it as an educational opportunity, because time flies, and it just, before you know it, it's 2-3 years down the road, 5-6 years, they haven't had their sprinklers checked, and we're like, thanks for coming back, we appreciate that, we totally forgot about it.
Ms. Gonzalez?
Not necessarily, no. Thank you.
Mr. Chair?
That's Mickey?
Real quick, my one concern would be the privacy issues going into apartments. So how do you balance that? And then second question on, you talked about reporting other issues. I don't know if there's a cause from a legal perspective, doing other enforcement, and I'm not as concerned about that. My main issue is privacy. But are we fine going out to these sites for inspections and then
Well, let me
using that?
tell you how I do it.
Yeah.
Yeah, you don't have to worry.
Okay.
So any life safety inspections, any life safety violations, we can go all the time and check it out. But as far as privacy things, so we go in and we'll either knock or we leave that on the property owner. So we're not going to go in and necessarily check all the smoke detectors, but we do make note, hey, you need to check it. You need to make sure you have your carbon monoxide detector working in working order. Some people will say, we'll go and ask them, hey, does that work? Can you go hit that for me? And they will. A lot of them will come out to me and say, hey, this thing's not working. It's broken. We told them they haven't fixed it yet. So they do that. So we don't go in there. There's been a couple times where they said, yeah, come in, can you check it? And they're glad to see me there, so I've gone in to do that. So any life safety violations, absolutely, I could come through there during the day. Nighttime, not necessarily, you have to schedule it, but during normal business hours, we can go in and do life safety checks. But we're not invading anyone's privacy. We're putting it on the property owner, and we're making note of it. And that's like kind of a common thing that I did on everything. Make sure you check each and every smoke detector to make sure they're working properly. Make sure you have defensible space. Make sure your fire extinguishers are serviceable. So I put that in every one of them, and they're going to get that mailed to them.
Great, thank you.
On the life safety, or they all invite you in basically as a consent entry?
You know what? We used to go and knock and say, hey, can we check this? And we don't do that. We throw it on the property owner. It's the property owner's responsibility to make sure they do work. There have been people that say, can you come in and check ours? So we don't go and ask to come in and check. They'll offer, and we're providing a public service. So we're like, yeah, absolutely, I'll come and check it. And there has been times where I've even had to give them a couple of smoke detectors until they could get it working properly. So and we check everything from the laundry rooms to the vehicles to the address numbers is the big one. That's one of the biggest violations. So we want to make sure that we can read every apartment number and every address number, because it gets a little confusing once we're going down there. So that's the big one that we're hitting on, making sure for public safety that we have the big address numbers and we can read the apartment numbers on them.
Peter, any questions?
No questions, Mr. Chair.
Any other questions from the board? Let's go to public comment. Any public comment?
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for allowing me to pull this item. So I have a few questions, and thank you, Chief or Fire Marshal Bedoya, for being here. In the old days, I don't know if it's still done. I know that it's done for new permits, but in the old days, fire departments used to visit the businesses to make sure that they were in compliance. I know that last year, I think it was in the summer, we had that fire in the 400 block of San Felipe, and it was wiring. It was people putting in extra extensions or something like that, but I know wiring was involved. So is the fire department making visits to businesses to confirm that they're in compliance and the back doors aren't locked and, that they have that kind of safety thing? Then the other issue that I'd like to bring up, and I don't know if it should be directed to you or maybe Mike Chambliss now that's over in code enforcement for the county. But what about all these RVs that are parked on private properties that are actually connecting themselves illegally to PG&E power? I mean, there are also environmental issues where they're dumping gray water, So that's one of the things that I would like to find out, whether that's something through you visiting these places because they are illegally tapping onto PG&E, or is that an issue that has to be brought up with PG&E? The safety of how many people are actually living in these RVs. Can they be living in these RVs? Is the county missing out on some kind of a revenue or permits that if people are going to be living in RVs on private property, maybe there's some kind of accountability as to how many people are on there? Should there be kind of a fee as well? So that's I guess my questions for now. Thank you.
Okay, for the record, Elia, I will have our legal counsel speak on that as we're doing some work on that as we speak. So
Yes,
I'll let her
we
go
did
ahead.
check, in the county, it's not legal to live in your travel trailer. There is a different provision that pertains to mobile homes, but then you have to go through the process that's set forth for mobile homes, but there's no living in the travel trailers. In the county, it could be different. In the incorporated city, you'd have to check their city code. And that's just
And
the
what do they
straight
do if
land use zoning issues.
what do they do if they have people or they suspect people? that are
They can
living-
file a complaint with RMA department, a code enforcement complaint.
Thank you.
Yeah, like usually with a city, you know, you have a certain amount of time that you could plug in, 72 hours or whatever the day is in the city too. And you're allowed to go ahead to get ready and overnight stay or anything to prepare for a trip or after a trip. But after that, then you do get cited.
Yes.
If you're living there. And I'm sure it's the same with the county also.
Okay. Any other public comment?
We have no more speakers at this time.
Bring it back to the board. What's the wish of the board?
I guess I'll do it. I move that we approve item number 15, approve resolution acknowledging Hollister Fire Department to perform inspection of certain occupancies required annually.
I'll second it.
Okay. All in favor?
Aye.
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 Opposed?
Thank you. I appreciate it.
5-0.
Thank you. I appreciate it. And I'll be coming to you annually with an update on what the status is.
Well,
and
thank you
everything.
for your time and
I appreciate it. It was a busy fall. In addition to, just so information, so you know, Chief Martin Del Campo won't be here for about 8 to 9 months. If you didn't know, he did get activated for full duty, active duty with the U.S. Army. So he's going to be in Pennsylvania. He's still available to all of you by email and phone calls if you guys need to get a hold of him. But he'll be there teaching at the War College to officers. So he'll be in Pennsylvania for about 9 months, but he's still available by telephone or email to you guys. So
who's the active chief as we speak?
you know what? He's still overall
Okay.
seen us. If you need any of us, we still have the BC on each day, and you
Yes.
have me for the 8 to 5
Okay.
days too. And we all respond to emergencies.
Oh, I
so-
know that. Thank you very much.
Perfect.
Appreciate
Thank
it.
you. Appreciate it.
We'll go to number 16. We're gonna, looking at approving amendment number 3 to legal services contract with Hooper, Lundy, and Bookman LLP for legal services in additional amount of $30,000 for a total contract amount not to exceed $180,000, and I believe that was pulled by a member of the public. Can, Barbara, do you want to elaborate on this?
Yes. They've been assisting the county in ongoing negotiations with DRC, as well as the first litigation matter that was filed by DRC against the county. The county just authorized in closed session execution of a settlement agreement once it's finalized, and that's going to be favorable to the county to avoid litigation. So this one is for work that they will help during the process currently and also into the period of the settlement, after the settlement agreement's executed as we implement it.
I'll go to public comment.
Members of the public who speak on this item, please press *9 or the raise your hand icon. Alia, please state your full name for the record. You will have 3 minutes.
Elias Salinas, I just wanted to clarify to the public what this item was, that it was going to be approved. So thank you, Barbara, for explaining it. Thank you.
Thank you. Bring it back.
And I should state that they have premier eminence in healthcare law, so they're very, very specialized.
Perfect. Thank you for that statement. Bring it back to the board. What's the wish of the board?
I move that we approve the amendment 3 to the legal counsel services for Hooper, Lundy, and Bookman for legal services in addition, in the amount of $30,000.
Is there a second?
I'll second.
All in favor?
Aye.
Aye.
Opposed?
Aye.
5-0. Number 17, emergency medical services. Approve an agreement with the State of California Department of Parks and Rec for the Hollister Hills recreational area to fund emergency medical services. I will let Colin talk about this real quick, being that he pulled it. I believe
Yeah,
we did.
thank you. I just had some questions on it. One, I noticed the contract date on the agenda. I kind of caught this last minute when I'm just going over figures again. Says the contract goes till July 2023. And then when I looked in the contract at the calculations and how they're figured out, it has $175 an hour times the estimate of 47.5 hours a month times 18 months, which gave you the $149,000 figure. And according, if we're going through 2023, I believe that would be 30 months.
Yeah, so unfortunately, Chris is not is available here to comment on this, but I will try to pick this up. My understanding it is for 18 months, and it's weekends. So they'll be working. It's going to include the weekends as well with the 18 months. So I believe that date is going to be incorrect, and we can make an adjustment on that.
Do we need to approve this today, or can we push this off until the 20?
We'll push it off. We'll push it off.
And I didn't mean to throw anything.
I mean, do you feel comfortable with that?
Yeah,
Okay,
yeah, I
so
just
let's-
want to make sure, because if it's
table-
30 months,
Yeah.
obviously the figure should be much.
Yeah, well, let's table
larger.
this until the 23rd.
Yep.
Okay.
Any public comment?
Members of the public who wish to speak on this item, please press *9 or the raise your hand icon. No speakers at this time.
Seeing none. Barbara, do we have to vote for that to table it, or is it just tabled?
I mean, if staff takes it off the agenda and just continues
Yeah,
it,
we'll
it's
just-
no big deal.
yeah,
You
okay.
don't need to vote on that.
Yeah.
I just want to make sure. Number 21, Office of Emergency Services. This is the adopt the resolution ratifying the County Administrative Office proclamation of local emergency. I'll leave this one to either Benny or Ray, one of the two.
Benny's going to take on this
Okay.
one.
Thank you, Mr. Espinosa. Mr. Chair, members of the board, Chris has had an appointment and couldn't be with us today, but I'll try to cover this item as best I can. It's pretty straightforward. It allows our local emergency proclamation, which the CAO has the authority to issue when you're not in session. So last week, he issued it as a result of the damage sustained by the county through the winter storm, the atmospheric river that came in the week before, January 26th through 28th. We've sustained substantial damages, particularly in South County, to our roads, and are still in the process of cleaning up and cleaning those now to get the roads back open. And at this point, everything's open except for one major washout on New Idria, and Coalinga is closed because there's work going on to repair the shoulders as we speak. What this does is it allows the governor then to consider including us in a statewide proclamation, not statewide, a governor proclamation at the state level that already included Monterey County and San Luis Obispo. And this would include us in that proclamation and makes us eligible potentially for state and or federal funding to assist with our repair work, which I have estimated preliminarily at $25 million, and that estimate has gone to the state. It doesn't mean we're going to get that much. First of all, the governor has to decide whether or not we would be included, and then they will send their own inspection teams down to verify whether or not they agree with our assessments of the damage. But it'll be a process. One of the reasons it's important to us, I think, is that we presently do not have the financial capacity to take on these repairs on our own. And there's some pretty serious issues that we ought to take care of, in my view. And so we're recommending that you ratify the CAO's emergency proclamation last week and empower him to end that emergency proclamation at an appropriate point in time after we see how it plays out with the state, essentially. Be happy to try to answer questions I have.
Well, this is in Supervisor Tiffany's district, so.
Very well.
Yes, this, after the storm, in conversations with, actually with one of my constituents, spends quite a bit of time in South County. And of course, Benny and his staff had already alerted us to the extensive damage, particularly in South County. It was thought that we should, as Benny said, Monterey and San Luis Obispo had already been declared as emergency declaration by the governor. And so I reached out to Assembly Member Rivas suggested that we may want to take a look at San Benito County as well. And he immediately put his staff on it, and then Benny and his staff has been assessing the damage, and this is where we are today. So I certainly think it makes sense. I think, as Benny said, nothing ventured, nothing gained. Whether or not we'll be successful remains to be seen, but there is very extensive damage. The roads, as I certainly have been hearing since I've been elected, the roads in South County are not good, and that's an understatement to begin with. And now they are much worse, and in some areas totally washed out, as in New Idria Road. So there's certainly a great need to address these roads, as well as there's some other roads in some other districts as well. And so I think it makes a lot of sense to take this next step.
Any questions from the board members?
Mr. Chair, if I may, I just wanted to show the board.
Oh, yes, sir.
One of our more serious issues that we're dealing with, and we had it up for a moment, but we want to share it so the public can see it as well. This is a drone view of a washout on New Idria Road, which about 20 miles south of Panoche. And that's, of course, an important county road that goes into a recreational area managed by the BLM, into an old ghost town that has great historicity. Was the location where they mined mercury during the gold rush. So we'd like to be able to fix that. Right now, we don't have the capacity to do it. And I have many other photos, but I won't belabor that this afternoon, Mr. Chair.
Yes, sir.
Unless Mr. Kosmicki would like, Mr. Tiffany would like to see more.
Yeah. No, I'm good.
Okay.
I'm good. I've seen them.
Any
Thank you.
public comment?
Members of the public who wish to speak on this item, please press star 9 or the raise your hand icon. Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas, thank you for pulling this item. So for years, I've been complaining about how bad the roads are in South County, especially because that's where I cycle the most, and it could be pretty hazardous out there riding your bicycle out there. So the thing is that I think we said before plenty of times is that SB1 money, and then we have the Measure G money. We need to be the squeaky wheel, and I think we even hired at $150,000 a year a consultant in Sacramento to speak on our behalf, and that kind of just went to the wayside because we didn't see any results. So somehow between whomever on the board making independent calls on yourselves is asking to get those funds back into our community, because we are in need of them. They're taking our tax dollars. We need to bring those tax dollars back instead of fixing the roads for the larger populations. We're poor. We're a large county. We're poor, but that doesn't stop them from taking our tax dollars, and we need to get those monies back so that we can fix our roads. Thank you.
Thank you, ma'am. Bring it back to the board. What's the wish of the board?
I move that we approve the adoption resolution ratifying the county administrative officer's proclamation of a local emergency.
Is there a second?
I'll second.
All in favor?
Aye.
Aye. Opposed?
Aye.
5-0, passes. Want to stay up there, Mr. Young? Approve a contract amendment number 4 with SCI Consulting Group for the annexation of 3 development projects to a community facilities district, 2018-01.
Mr. Chair, thank you. Members of the board.
Who pulled this one?
Pardon?
Who pulled this one? I did.
Okay. What was your question?
Oh, yeah, thank you, Mr. Chair. So I'm wondering what the 3, I didn't see it, maybe I missed it, the 3 annexed projects.
That's a fair question. We should have included that. Thank you for asking, Mr. Chair, members of the board. The 3 projects, 2 of the 3 are already entitled and under development, but this is a way to fund the care and upkeep of the public infrastructure within those developments. The 3 that we're talking about today are Sunnyside Estates and Bennett Ranch off of Southside Road. And there's only one of the projects is not entitled yet, but it's in the process. It's been on hold as a result of a lawsuit that we had nothing to do with. But that's Promontory Bluffs, I think it's called.
Oh, the Bluffs by Ridgemark?
Yes, sir.
Okay.
And this SCI simply helps us with administration of the CFDs to provide those services.
Okay. And so the Bluffs project, where is that at? You said it's just on hold?
It's just south of Ridgemark, up on the bluffs, that's why they call it that. Looking down over Southside Road, and there's a large, sort of a large farm area there, I forget the name of it. But it's about maybe a mile south of Union, on the way over to Tres Pinos.
And it's been approved to, I guess, can you clarify to what level it's been approved?
It's a vesting tentative plat, and I think they're having our staff answer a few remaining questions with regard to the tentative plat, and then it would proceed to final approval.
So
there's been an EIR done, and there's still a few questions and issues that need to be worked out, but it's quite far along in the process.
So what's the thinking, I guess, with including it in the CFD when it hasn't been approved by the board yet?
As part of the process for entitling the land use, they have to do a financial analysis to show how that their project won't become a drain on the general taxpayers. So they've done that, and I think that becomes the premise for including them in the CFD. I could be wrong. Maybe Mr. Ellenwood or someone can help me.
Right, or Joel, I'm sorry.
Yes, again, what's been approved is a vesting tentative subdivision map, and that's approved at the Planning Commission level. When the project completes all of its conditions of approval of the vesting tentative map, it comes before the board for approval of the final map. And that final map approval is a ministerial one. It's just check the boxes of have they satisfied all the conditions, and is the map in the proper form for recording before individual plots could be sold.
How many units are we talking to? Do you know offhand? I'm sorry.
The Bluffs
I think they're about 100,
or it's
90 or
98?
100
I think
in that range.
For some reason, 98 hits me. I don't know why. I could be wrong, Ray.
It's okay. I got you.
I think most of the scope of this work is for all this, probably, they're really focused on the annual CFD levy this year.
Correct.
But my only concern is including a development in the CFD that hasn't really officially been approved yet.
It has been approved. Again, the vesting tentative map is the discretionary level of approval that has been granted, and that is granted with conditions of approval.
Yes.
And then before the final map can be recorded and the property sold, the improvements have to be completed or bonded, and financing and the other conditions of approval be met. And so the final step, the approval of the final map, is the last step in the process, but it is not a discretionary approval.
But it's being held up for now, for a while. I mean,
They had a lawsuit with the neighbors.
okay.
I'm sorry, I want to redirect the conversation a little bit, and I have not gone back to review everything that happened in this, this issue, but I believe that the annexation of those 3 development projects, and that probably, it happened prior to Benny coming on board, it was with prior staff, that process is already completed, and that CFD was formed. This is for the annual levy. You can see that in the back history of it, where originally that they had a higher dollar amount per year, that $44,000. Since that time, they've been doing the annual levy. Like last year, it was $19,750. They were doing the annual kind of, I think it's the annual amount is what is
What's
really
for the
before board.
continuation of the, it's,
Yeah. Yeah.
8,000 of this contract is for the cost, an upfront cost for working on the annexations,
Which annexations?
the 3 that Benny just mentioned.
Well, I guess, I thought that was already completed. Well, actually, so I guess I don't know the answer to that question. Shirley was indicating that $8,500 is for the annexations. Maybe there's some sort of process that still needs to be completed in making sure that those rolls are correct each year.
Yes, if you look in amendment number 4 to the contract, page 3 at the bottom, it outlines what the breakdown of the additional costs that are in this particular amendment. There's a one-time fee of $8,000 in this fiscal year for services related to annexing 3 new developments into CFD 2018-01. And then there's also an ongoing increase in the annual fee because they'll have 3 new developments in that CFD. So when they do the annual levy services going forward, the annual cost will be a little bit higher as well. And if you look on the next page, there's a table that has the breakdown by fiscal year for both CFD 2015-1 and 2018-1. And you can see the actual amounts that are assigned to each CFD for each fiscal year.
But to be clear, this would be annexing these projects into the CFD then?
There's a countywide CFD that's available for this, and then some projects like Santana Ranch have their own CFD. But the county in 2018 set up a countywide.
Yeah, no, I understand. I guess my concern again is just maybe prematurely annexing a project into a CFD before it's even approved.
Well,
I guess you're saying, in your opinion, it's approved, but before it goes through the final process.
Yes, I think what county council is trying to say is it's already been approved, and all that's left is to finalize the plat, and that, when that comes to the board, kind of like it or not, it's not a discretionary approval. If they've satisfied the conditions, the county must approve the plat.
Okay.
Also, just a little final note on the money piece. These are all amounts not to exceed. So if for some reason they annexed the annexations of 2 of the new developments happened, but the third didn't, then that wouldn't incur the full amount of the additional budget.
Okay. Yeah, I just want to make it clear that, by approving this is not an indication that there's support, because this was something that was approved prior to this board taking office, and I just want to make it clear that this is not an indication of my support for any of those projects in particular.
Understood.
Any other questions from the board members? How about public comment?
Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas. I just wanted to point out, thank you, Supervisor Kosminski, for pulling this item, because what I did notice, and thank you for bringing up, is the fact that this was placed on the agenda, and this has happened before, where you don't give specific information, and I do not like the Board of Supervisors to be accused of not being transparent, especially because this item was under consent. You must give as much information so that transparency is not questioned. So thank you.
You're welcome. Any other public comment?
We have no more speakers.
We'll bring it back to the board. What's the wish of the board?
I have a question
Oh, of
regarding
course.
this one. Because there was the lack of transparency, and if we did not approve this today, would there be a consequence to any of the procedure, the ongoing procedure?
Mr. Chair, Supervisor Gonzalez, I think I need to own the fact that we didn't include enough facts. And so I acknowledge that, and we need to provide more background in our staff reports. And with my apologies, I will plan to do that. This particular item is important because we have Bennett Ranch and Sunnyside Estates very close to completion of the units that are planned, and I would like to be able to have access to the levy to have those funds raised to take care of the improvements in those subdivisions sooner than later. So I would really appreciate it if you would move this forward, and we'll acknowledge the need to provide a more comprehensive staff report.
Is that all right with you?
Yes, and then with the caveat, this is something that you inherited. It wasn't something that was, began with you.
Well, I'm here, I own it.
Yeah,
So-
well, you do now, yes.
What's the wish of the board?
I'll make a motion that we approve the contract amendment number 4 with SCI Consulting Group.
Is there a second?
I'll second it.
All in favor?
Aye.
Opposed?
Thank you, Mr.
Aye.
You're opposed or you are for?
He was aye.
Oh, I see. Okay. 5-0. Now we'll go to number 23. Adopt the resolution adopting the initial study of a mitigated neck declaration prepared in compliance with the California Environmental Quality Act. We'll go to.
Yeah, I'm sorry again. I'll make it really quick. So this is in my district, and I just, because I'm newer to this one, the funding for this project.
This, Mr. Chair, members of the board, thank you for the question. It's funded by a federal funding category called Highway Bridge Protection, HBP, and that program is accessible to us. It's about a $2 million project to replace a small bridge on Anzar Road that is functionally and structurally obsolete and needs to be replaced for the safety of the public.
Okay. That's all.
Go to public comment. Any public comment?
Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas. Okay, so is the road open now? I mean, it's been a while since I've been down Ansar Road. So is there liability? You've just made it public that it's not really feasible to drive on. So is it closed to mitigate any kind of liability so someone gets hurt because the bridge falls apart?
Mr. Chair, would you like for me to respond to that?
Legal counsel, can you
I'm sorry.
respond to that?
I'm sorry, I was texting. What was the question?
There was a question about liability.
Liability.
And the safeness of the road.
I believe I might have an answer, Barbara.
Yes.
And then
You guys can
you or
tag team that, please.
You or Shirley.
Or
can,
Joel, did you, were you paying attention to that?
I'm not involved in this project, and
Okay.
Shirley perhaps can address it from the.
Yeah, I'd rather have legal
Can I?
answer it first, and then you can go after.
Okay, very well.
I just want to,
I'm just dying to say something.
yeah, you'll get your last one, but I just want legal to
Fair
step in.
Shirley Murphy, Deputy County Counsel. So the information in the staff report indicates it's functionally obsolete in terms of the design. It doesn't say that it is in imminent danger of failure or an imminent health and safety risk. So I'm speculating at this point, and Benny can please correct me if I'm wrong, but I do not believe that the bridge has been closed or that it needs to be at this time.
Okay, Mr. Young, I'll let you go now.
I concur
Thank you,
completely
ma'am.
with what County Council just said. It's functionally obsolete. It needs to be replaced. The time will come when it's not safe. But it's presently open and it's capable of conveying the traffic that we have now. But time is running, the clock is running on this, and we hope to commence construction about a year from now. So we're on a path to take care of it. For the moment, I believe that we can leave it open.
Excuse me, can I ask a quick question
Yes,
of
sir.
Benny? Benny, I'm just curious. So I know on the, if I recall, on the Hospital Road Bridge, that is, there's funding from federal government for that?
Correct. That's the
So
same
where does it
program.
fall on, this is coming out of our general fund. Where does, I'm just trying to learn here. Where does it fall, you know, as far as funding go on a bridge like Hospital Road Bridge versus something like this? How's that determined?
It's essentially the same, Mr. Chair, Mr. Tiffany. The funding source for the bridge replacement at Anzar is the same one that's being used to build the new bridge at Hospital.
It's the same.
So it's mostly federal funds. And the county does have a matching requirement for the federal funds. And what we've been doing is funding our match out of collected impact fees, regional impact fees, so it doesn't have to come out of the general fund.
So generally speaking, the majority of funds for bridges come from federal funds?
Oh, yes, it's
Yes,
75 or 80%.
Okay.
It's, the bulk of the funding comes from the Highway Bridge Program.
Thank you.
And I would request maybe, I'm thinking out loud here, if you can send the board the updated list of all the federally funded jobs that we have?
Tuesday, we're going to have a great presentation from Benny Young,
That Tuesday.
Hey,
our RMA director,
yeah.
that will just
You-
cover all
Yeah,
roads
exactly,
and
'cause
all
that's-
bridges.
That's interesting, Supervisor Tiffany. It's interesting what you just said, because that's
Yeah.
my first.
I
year.
knew that. I
Yeah.
was just trying to prepare us.
Oh.
No, I'm just kidding.
Thanks for the.
Okay, any other public comment?
We have no more speakers at this
We'll
time.
bring it back to the board. What's the wish of the board?
Mr. Chair, real quick, I forgot.
Oh, sorry.
Yes.
One issue, I just wanted to make sure, there was a letter from the residents in the area, the Hanson family, that they had a number of concerns, but one of the concerns they brought up was that they're swallowing nests, that there's the birds that basically nest under the bridge, and at some point when some farmers, or I don't know the exact narrative, some farmers put up nets, those birds were then displaced, and they had issues at their home with, it sounded like bird excrement, and she had to power wash the house. I'm just wondering if there's I don't know if there's anything we can do to mitigate that sort of impact, and just to make sure that that's on the radar.
Mr. Chair, I'm receiving a whole lot of really fair questions today, and that's a good one. It's a fair question, and there will be attention paid to that during construction, and mitigation measures will be implemented to protect the nesting swallows. They happen to be swallows, golondrinas, and they're beautiful birds. And we will, in consultation with the California Department of Fish and Wildlife, make sure that they're cared for, both as the bridge is demolished and as the new bridge is constructed. And I would venture a guess that they will eventually show up again after the new bridge is built. But in the meantime, we'll do pre-construction surveys, we'll establish buffer zones. We may have to relocate some of the nest starts during the off-breeding season, and we may have to use some netting just to protect them, not so much us or the bridge for now.
Thank you, sir.
Thank you.
Does that answer your question?
Yes, sir.
What's the wish of the board?
Yes, I'll move to approve. I'll move to approve item number, sorry, I'm trying to pull it back up here.
23.
Item number 23, resolution for initial study mitigated negative declaration prepared in compliance with CEQA and adopting CEQA findings on monitoring and reporting for the Anzar Road at San Juan Creek Bridge Replacement Project.
Is there a second?
Second.
All in favor?
Aye.
Opposed?
Aye.
5-0. Now Mr. Young, you can stay up there again.
Okay.
Actually, for two more. Resource Management will approve EMC Planning Group EIR Contract Amendment Number 2 for Ridgemark Master Plan PLN 170008 to add a subcontract with Hexagon to provide the VMT traffic analysis. And this was pulled by, was that by you, Mr.
Yeah, that's
Krisky?
me, I'm sorry.
Yeah, go ahead.
So yeah, just wondering if, mentioned that there was, I think, 3 concerns. One of the concerns was discrepancies in the, inconsistencies in the project description and the tentative map as the reasons for wanting to bring on this consultant. And I was just wondering, and if you don't have that answer, that's fine. I'm wondering if there is any explanation of what, is there something we need to be concerned about here, that they're sort of changing the project description as we go, or?
Sorry, I didn't mean to interrupt you. I apologize.
I think Joel has.
I'll try to answer that, and then Joel can add.
Okay.
This project is fairly early in the EIR process, and the EIR is in preparation. And one of the tasks that's changed since the project was conceptualized is the way you analyze traffic impacts. And so a sub-consultant named Hexagon, they're very good. Traffic specialists are coming on board to address the traffic impacts of the project, consistent with a new law that's changed it from average daily traffic analysis to vehicle miles traveled. And so that's all this is doing. They're in the process now. The EIR is in preparation. It's pretty early in the process. This is a cost reimbursable project. And so the developer is responsible for all the costs. And basically what they're doing is converting one of 2 golf courses within Ridgemark to multiple use, mainly residential, if successful through the process. So it will eventually come to the Planning Commission and to you all for a decision. I recommend you hold specific comments with regard to the, the merits of the project until it goes through the process.
Well, you said one thing that caught my ear, 100% reimbursable, correct?
Correct.
Okay, thank you. Joel, do you have to add anything?
No, I don't, thank you. I think that explained it. It's a change in the law as far as traffic impact analysis under CEQA. And so when the project was initiated, we did not conduct VMT, vehicle miles traveled analysis. Now we're required to do so, so that's a change in the scope of the EIR to change the basis of the traffic analysis.
And by approving this or accepting it, in no way, shape, or form does any board member say they're for this project?
Correct.
That's correct.
Okay, I just wanted to reiterate what I knew
Or the
Supervisor
converse.
Kaminsky was going to ask. Right.
There'll
Any
come a
other
time.
questions, sir?
No,
Colin?
thank you.
Okay. Any public comment? No,
Elia, please state your full name for the record. You will have 3 minutes.
I know you guys are getting tired of me. It's
Never.
almost over, okay, guys?
Never with you.
So, so my question is, did I miss the RFP for the contract for Hexagon? How did we get Hexagon to be the subcontractor? That's my question. Thank you.
Mr. Young, was that before your time, or was that,
Well, yes, but I think I have to own it. But this was not a public solicitation because it's just a subcontract, and I think they were asked to join the team by the principal
okay.
contractor.
And all that is legal eagle?
It's with the contractor that's providing the service.
Okay, so if we had to bring them in for the county, then we would have to go through the RFP.
Yes,
Am I
unless
correct?
you were doing sole source.
Okay,
Yeah.
thank you very much for that clarity. Any other questions from the board? What is the wish of the board?
I'll make a motion that we approve EMC Planning Group EIR Contract Amendment Number 2 for Ridgemark Master Plan to add a subcontract with Hexagon to provide a VMT traffic analysis.
Do we have a second?
Second.
All in favor?
Aye.
Aye.
5-0, motion passes. Now we'll go to I think it's the final one. Yes, number 26, our final one. Resource Management Agency, once again, Mr. Young. We're getting our money's worth today from you.
Mr. Chair, members of the board, you're probably as tired of listening to me as I am.
No, not at all, sir.
I get very tired of the sound of my own voice, but thank you for your indulgence.
You and Elliot took the show today, okay?
Thank you. Mr. Chair, members of the board, Mr. Espinosa, all you would be approving today is authorizing me to sign a permit application to the state as the owner's representative. You're not actually approving what they're proposing, but in simple terms, the expansion of the landfill is just beginning, the IR process for that. And that's going to take quite some time. And so Waste Connections is concerned that they're going to run, that we're going to hit a point where we have to stop the importation of out-of-county waste because there's only 15 years left of local waste. And we're getting fairly close to that point. So what this proposal anticipates doing is extending time a little bit by transferring some of the waste that would otherwise go into the landfill elsewhere. And it would be a direct line on-site facility where they bring the garbage in trucks, and then it's backed up to a semi and pushed in, and then they haul the semi off to another authorized and properly regulated landfill elsewhere, just to buy time so that they, in theory, would be able to protect their income stream associated with the waste coming to the landfill, and it would also protect the county's income stream, potentially the revenue that we receive in the general fund. So we're not actually approving that I have suggested that you authorize me to sign the petition, sign the permit request to the state. And the proposal's actually been prepared by Waste Connections, and then they will submit it to Cal Recycles, and we'll see, what the response of the state is. I have recommended that when it does come back to you for final approval, there would be certain conditions that we'd want to see adhered to before you finally approve this. All you would do today is authorize me to sign the permit application. And they're outlined on page 2 of the staff report. And the one at the top is that Waste Connections would have to stop importation of out-of-county waste whenever we hit that 15-year mark. This, if it works, would potentially extend that time a little bit. And there are other recommended conditions like covering all related costs, completing CEQA requirements if necessary, and we might even need to modify our landfill agreement number 2 to some extent, and provide indemnification for waste that would otherwise come here going to a different landfill somewhere else. And agree to incur any costs if the haulers have additional costs as a result of the transfer operation on site. And so that's the extent of it. I think Waste Connections may be online and able to answer more detailed questions if you have them, but essentially, this just gets the permit process started for them. And I'm of the opinion that we should allow that to begin.
Well, thank you very much. First of all, I just want to make sure we're crystal clear about something is we should always have 15 years of life
Correct.
in that, on that landfill.
Local.
Yeah, I'm sorry. Thank you very much. That was very local landfill. Secondly is by signing this, all it allows us to do is start the process. There's nothing finalized until it comes back to us when we actually execute the permit.
That's my understanding, Mr. Chair.
Is that your understanding, Barbara? So this is just, once again, starting the process. We're not approving anything. In theory, we're not approving anything today. We're just starting the process. Once the permit comes back and we agree on that, then we've asked for the transfer station. Am I safe to assume that? Okay, I wanted to be clear. Supervisor Tiffany?
No, I have no comment. I think it makes sense that we move forward on this.
Just with the understanding that something will be coming back to the board beyond this initial step. Yes, and I'm good with that.
I'm good.
Peter?
Agreed, Mr. Chair.
Okay, any public comment?
Elia, please state your full name for the record. You will have 3 minutes.
Elia Salinas. So I'm not so much interested in what the cost is going to be for Waste Connection. I'm more concerned about the wear and tear on our roads. So is that going to be included? We're going to have extra vehicles coming on to our county roads using to get to the landfill. So is there a way we're going to be reimbursed somehow for our roads that are for the wear and tear? And then my last question would be, is this just general waste, or is this actually recyclable items that this project is for? Thank you.
Mr. Chair, I'll answer the latter question first. It's residential waste brought to the landfill by commercial haulers. They would divert a portion of the local waste elsewhere during the period of the transfer station operation if it's successful and approved. So it doesn't involve recyclables. It's regular household and commercial waste that's picked up by Recology and taken to the landfill. And pardon me, Elia, I think I missed the first part of the question because I listened.
The first part of the question had to do with now that we have another truck, in theory, picking up and dropping off, are they paying for the additional wear and tear on our streets, our roads?
I would say yes and no. That's one of the reasons that there's a possibility we might have to do a CEQA process just for this transfer station. Waste Connections doesn't believe so, but county council is looking at the possibility that we might have to, in which case that would be one of the key issues. I believe their position, and maybe they're online, they can represent their own position, is that it's below the permitted level of truck traffic already authorized by the existing permit, and therefore doesn't add to the traffic on the roads. Whether or not that's correct is a matter for continued discussion with them before it's finalized. And to give the board some comfort, there's already a contribution of $1 per ton toward road needs associated with the landfill operation. And then if the landfill expansion is approved, I think there's another $2 million contribution anticipated toward to the effects on the road system here.
And just to dovetail on that, what I'm thinking also is, once we have to actually sign on the dotted line, we can always negotiate something with them in regards to an additional charge, simply because they're using that road in theory twice.
Mr. Chair, you might invite Mr. Nelson if he's listening in. I asked him to stand by.
Oh, Mr. Paul Nelson, do you have anything to add?
Maybe he was here this morning.
Okay, well, any public comment? Any additional?
Hey, no, I'm here. Can you hear me?
Yes, sir. Loud and clear.
All right. Thank you for the opportunity to present. I think Benny explained the project very well. I mean, all that we're seeking today for your approval would be to actually sign the application for this potential transfer station that could go in place subject to the timing of the entitlements around the expansion. Benny's also absolutely correct that that $1 per ton already exists in a portion of our host payments. Additionally, we're paying $200,000 a year for a sum total of that $2 million for potential road alignment, John Smith Road landfill. So I think in the event that we ever finally triggered the operation of this transfer station, we'd be looking at roughly 10 vehicles, that the loads would be loaded into and would be run out of the landfill and back to the landfill. So it's 10 additional trips. And Benny's correct that we believe it's within our right based upon our current CEQA landfill airspace that we currently have in place.
Any other questions from the board?
Mr. Chair, if I could modify slightly the recommended action just to emphasize the point that was raised by the board today, it would be that authorize the county's resource management director to sign the registration permit application subject to county's final approval and amendment of the landfill agreement.
Yes, ma'am. Any other public comment?
We have no more speakers.
Bring it
at
back
this
to the
time.
board. What's the wish of the board?
I'll move to approve item number 26, authorization to sign and submit a direct transfer permit application with CalRecycle. Staff will seek actual authorization to implement the direct transfer option at a future board meeting contingent upon state review and Waste Connections agreement to several conditions and including the county council's amended verbiage.
That's sufficient.
I'll second it.
We've got a second. All in favor?
Aye.
Aye.
5-0. Motion passes.
Thank you, Mr. Chair.
It's 3:10. That concludes our meeting. We will have our next board retreat next Tuesday, and then the next board meeting would be the Tuesday after. So, guys, have a good day. Is there a motion for adjournment?
I'll make a motion to adjourn.
Is there a second?
Second.
All in favor?
Aye.
You take these?
Yes.
Yes.
Goodbye.